OBP, hails from Ogoloma in Okrika local government area, River State. He is the 12th Vice Chancellor of River State University. He holds a Bachelor of Education, B.Ed degree in Economics from the University of Ibadan, a Master of Business Administration, MBA degree in Management, and a Doctor of Philosophy degree in Organizational Behavior, both from the River State University. His academic journey began remarkably, earning his West African School certificate in 4 years after a double promotion due to excellent performance. He commenced his career at River State University in 1997 as an assistant lecturer, progressing steadily to become a professor of management in 2018. His areas of specialization include organizational behavior, human resource management, and industrial relations. Over his nearly 28 years of teaching, he has amassed over 100 publications and supervised more than 60 doctoral graduates. Professor Zeb OBP's extensive administrative experience includes serving as the director of the university's Information and Communication Technology Center, ICTC, University Orator, Dean of Student Affairs, and a member of the Senate Management Committee and Governing Council. His tenure is marked by significant achievements and innovations. As a faculty examination officer, he led the transition from manual to digital results management, earning an award for his contributions to ICT in education. As acting head of the Department of Management, he designed the current tabular outlay for examination offenses and penalties and introduced professional body lecture series. As the Dean of Student Affairs, he facilitated the completion of 2 hostels, introduced electronic voting for student union elections, and established a dialogue culture, preventing major student disruptions. He also revived the university senior staff club, introducing the Vice Chancellor Cup inter-union football match. As ICT Director, he implemented a results before excuse culture, an annual evaluation and Thanksgiving ceremonies that have spread across the university. Notably, as the longest-serving university orator, he has read over 71 inaugural lecture citations and through his innovations attracted substantial endowments and donations to the university. From a field of 15 candidates, Professor Isaac Zeb OBP emerged as the top candidate, scoring over 90% in the interview process. His appointment as the 12th Vice Chancellor, 9th substantive Vice Chancellor of the River State University was approved by the Visitor and Governor of River State, effective from Thursday, March 6th, 2025. With that, please welcome our Chief Host of the 5th Malaria Annual Health Colloquium, the Digital Vice Chancellor, River State University, Professor Isaac Zeb OBP.
Good morning, everyone. Before we continue, I would just like to call Dr. Fred Owiko to present the award to the Vice Chancellor. He is the Chairman, Association of Medical Laboratory Sciences of Nigeria, River State Branch. Can we give him a round of applause, please? Dr. Fred Owiko.
the Vice Chancellor, Rivers State University, in recognition of your distinguished leadership and gracious acceptance to join the cause of malaria elimination in Africa. Your commitment to research, education, and institutional partnership strengthens the collective resolve to achieve a malaria-free future. On behalf of the EKPRIKPO Health Foundation, I present this award to you. Thank you, guys.
You only have one life to live. If you're lucky, then you might get two. I was never so down to it. Was a miracle that got me through. Must in the world, made my views. Got plenty of scars, but nothing to lose.
Up next, we're going to call the convener of this colloquium and the president of the EKPRIKPO Health Foundation to give his welcome address. He's the reason why we're here, so we all have to give him a very big round of applause. Can I welcome Dr. EKPRIKPO?
And a brief citation of Dr. ERENS. Dr. ERENS is a distinguished dermatologist in Rivers State University. His exceptional contributions to public health and youth leadership has earned him global recognition as the president and founder of the EKPRIKPO Health Foundation. Dr. ERENS has been a driving force in advancing healthcare access in underserved rural communities across Rivers State and beyond. Through the EKPRIKPO Health Foundation, he spearheads impactful initiatives, especially around the eradication of malaria, including free medical outreach programs providing screenings, consultations, and medications, as well as campaigns promoting accurate healthcare information. Some of his notable efforts include the Hepatitis B Awareness Campaign and free medical outreach at Rivers State University in collaboration with the National Association of Academic Technologists and his advocacy for specialized malaria funding during the Malaria Annual Health Colloquium, which he has convened successfully for the last 4 years and counting, emphasizing on innovative solutions. His transformative work has earned him a prestigious nomination as an awardee at the Asian Pacific Youth Leaders Assembly 2025 in Seoul, South Korea, a testament to his leadership and commitment to health equity. Dr. ERENS' dedication to fostering sustainable community development through health advocacy and education continues to inspire and uplift countless lives, aligning with global best practices and sustainable development goals. Ladies and gentlemen, please welcome our distinguished convener of the 5th Malaria Annual Health Colloquium, Dr. EKPRIKPO ERENS.
Thank you very much. It feels like I'm in church already. Good morning, everybody. So I'd like to thank the Vice Chancellor of this prestigious university for this gracious privilege. I do not take it for granted. Thank you so much, sir, for this privilege. As our chief host, we're really happy that you joined this course. And also I'd like to thank our digital provost. On all occasions, he has always supported us. Thank you very much, sir. We're grateful. Every other distinguished professor here, deans of faculties, heads of departments, I thank you greatly and I celebrate you. God bless you. I'd like to count the great privilege from God Almighty, the giver of life. We are nothing but what? Pencils in the hands of the Creator. It's by His mercy that we are here. And I take no glory of my own, I return all glory to God. Amen. Our chief host, the Vice Chancellor of the prestigious Rivers State University, Professor Isaac Zebobibi. Our co-convener, she is on her way, the Executive Secretary of the Rivers State Contributory Health Protection Program, Dr. Betty Agalo. Professors here, deans of faculties, heads of departments, the immediate past Commissioner for Health, who is ably represented today by Dr. Ireju Ajay. Of course, we should clap for the Commissioner of Health. So I've done really well. Please extend our warm appreciation to her for always supporting what we do. Thank you. Our keynote speaker and also my dean, Please let's celebrate Professor Oboro. Thank you very much.
Please permit me, please don't be angry, with the kind permission of the Vice Chancellor, please can we all rise as we welcome the Deputy Governor of Rivers State, every represented by Dr. Betty Agala. She is the Executive Secretary, Rivers State Contributory Health Protection Program, RIVCHPP. Please can we put our hands together as the Deputy Governor? You're welcome, ma'am. Please have your seats. Permit me to also invite to come forward the head of campus, our woman, Professor Scott Apula-Pisa, who's really in contact. Thank you very much. Now over to Mr. ERENS. Thank you.
Thank you very much. A sincere appreciation to the Deputy Governor of Rivers State, Professor Otto Mark of the GSS. Please let's celebrate her. She's represented by the Executive Secretary of the Rivers State Contributory Health Protection Program. So she's wearing two caps today. She's also a co-host today. So celebrate her in those two capacities. Thank you very much, ma'am. You're welcome, Your Excellency. So back to my speech. I was in where? So it's my distinct honor to welcome you to the 5th Malaria Annual Health Colloquium, proudly convened by the EKPRIKPO Health Foundation and the Rivers State Contributory Health Protection Program, RIVCHPP, with our chief host, the revered Vice Chancellor of this prestigious university, Professor Isaac ZEB. We are honored also to have today in our midst the immediate past Commissioner for Health, Dr. Adeze Ore. Please let's celebrate her now. She is represented today by Dr. Imeju Ajay. Thank you very much. With our panelists today, which are distinguished scholars whose work continues to shape public health in our region, we are especially privileged that our keynote address on the theme will be delivered by Professor Oboro, whose expertise will set the tone for today's deliberations. For 5 years now, this colloquium has united science, policy, and community action against one common enemy, malaria. Our theme this year, accelerating malaria elimination through academic innovation. Rivers State University leads the way, affirms that the solutions we seek will be driven by research, data, and innovations developed within the walls of the university. We recognize that technology is the future of public health, and today we also have a tech innovator joining us. Please let's celebrate Mr. Lucas Bruce. Your hands together. He will be showing us how we can harness digital tools, data systems, and emerging technologies to strengthen surveillance, diagnostics, and community engagement for malaria elimination. To our chief host, our revered Professor Isaac Zeb Obibi, I'll proudly call him the Digital Vice Chancellor. Thank you for positioning Rivers State University as a hub for scholarships that solves real-life problems. To build on this, sir, we respectfully propose the establishment of a Center for Health Innovation and Research Funding within the Rivers State University. The center will source grants, build partnerships, and mobilize support for research and innovations in public health and allied fields. It will give our researchers, faculties, and students the structure and resources to pursue high-impact malaria research, emerging diseases, and health system strengthening from ideas to implementation. Rivers State University is uniquely positioned to pioneer this model. To my co-host, Dr. Betty Agaba, who happens to wear 2 caps today, the Executive Secretary of RIVCHPP, thank you for your steadfast partnership. Please let's celebrate Dr. Betty Agaba. And leadership in advancing health protection in Rivers State. Your work proves that universal health coverage and disease elimination works hand in hand. We extend our hands of call to the Niger Delta Development Commission, first commending the Commission for their work that it has done in this region so far. Under the visionary leadership of the Managing Director, Dr. Samuel Oboku, we respectfully invite the NDDC to key into what we are doing through this colloquium. The proposed Center for Health Innovation and Research Funding, and to support our rural outreach to hard-to-reach communities across the Niger Delta. Strategic partnership with the NDDC will accelerate research-driven interventions and ensure lasting impact where it matters the most. To our media partners, please let's celebrate inside the Niger Delta. Your hands together. We trust you to know that inside the Niger Delta started partnering with us some 3 years ago, and they have been doing good jobs with us. This broadcast will be on all your major national televisions, including AIT and RICE channels and all that. Please let's celebrate them once again. And also to the Managing Director, I want to sincerely send my greetings and appreciation. We were in Delta State as regards of these wonderful people to give these same services to a particular community called Ibili in Isoko South. And it was a very wonderful experience. We partnered, and of course, countless lives were met as regards of people. So celebrating inside the Niger Delta once again. And also, another partner we have today is Salt TV. Please celebrate Salt TV. Salt TV is also an online platform. As I speak now, all these deliberations are right now online. The link will be sent to all of you for you to share with your communities, friends, and relatives. Of course, colleagues and all that. For this event, as we speak, it's already live on the internet. Let's celebrate Salt TV. All men of the press here today, thank you for taking evidence from this room to communities and decision makers who must act on it. At the core of EEHF, partnership is our core value. We remain open to collaborations as we continue our rural outreach to hard-to-reach communities in Rivers State and beyond. We invite support from governments, which we're already having to see today, sister organizations, companies, and well-meaning individuals to join this cause. We especially like to thank the Rivers State Ministry of Health. Thank you very much for your support and your collaboration over the years. We also like to thank all the bodies that we've worked with over the years. We've worked with the ELIMINATION, the Association of Medical Laboratory Science, the Association of Pharmaceutical Society of Nigeria, of course, RIVCHPP, and so more. We really thank you over the years for your support, and we hope that we'll build a formidable team going forward. The board and members and volunteers of EEHF. Mr. Vice Chancellor, Professor Sir, permits me to do this one thing, Prof. Behind what you see is not just this man, it is a group of young people. Please, with your kind permission, every EEHF member should come and think about. Let's celebrate them. They are the engines behind what we do. I'm just a poster boy. Just come here to show you some suits. But these are the guys that work. Every EEHF member, please make yourself to me. Make your way to the podium. Please, let's celebrate them as they come. We'd like to also thank the River State Coordinator of the WHO and all associations and bodies who have made this event possible. I'd like to thank my family and my wife for supporting me with this kind of gigantic, anyhow kind of behavior. Please, let's celebrate my wife. Yes. I'd like to sincerely appreciate her and my family for supporting me and supporting what we do and allowing us to take some big sacrifices and hope that someday prosperity will speak well of us. Thank you very much. Please, let's celebrate as well. Today, as we examine data, debate policy, and explore tech-driven solutions, let us commit to building structures that sustain innovations beyond events. With academic leadership, dedicated funding, and strong collaborations, malaria eradication is achievable, and Rivers State University truly can lead the way. Welcome, and may we have good deliberations today that will save lives tomorrow. Thank you, and welcome to the Colloquium.
Thank you very much, Dr. Smith, for that warm welcome. So we just had a very insightful welcome address. One core message I took was, for the past 5 years, this foundation has brought together science, policy and community action against one common enemy, malaria. And today, every one of us will become part of that shared mission. Now, we've also been informed that we're on air, so we need to look our best, we need to show them what meaningful engagement is, because it doesn't just end in this room. Our contributions are going, to determine policies and every other thing in between. So now, we will be moving to the next segment of today's program. Distinguished ladies and gentlemen, at this point, it is my honor to invite the Vice Chancellor of Rivers State University, our chief host, to deliver his address. He is ably represented today by Professor Fortune Malaria, who will be delivering his address. Please let us give her a warm welcome.
The Deputy Governor, ably represented by the Executive Secretary of RIVCHPP, Dr. Betty Adala, the Provost of the College of Medical Sciences, Deans of Faculties here present, distinguished members of the high table, heads of departments, professors, lecturers, distinguished guests, students, ladies and gentlemen of the press, let me say a big welcome to all of you to this 5th Malaria Annual Health Colloquium. It is themed Accelerating Malaria Elimination through Academic Excellence. Academic Innovation, Rivers State University leads the way. It is an honor for me to stand in for our digital Vice Chancellor, who is unable to come out due to some exigencies with respect to management matters. But I tell you that what tingles the VC's ears are the words or the phrase research, development, innovation, solutions to solving societal problems. And whenever it gets to hear that, you can move in. So I want to appreciate him for backing up this colloquium and supporting it to a successful stage today. So, despite decades of progress, malaria continues to claim hundreds of thousands of lives each year, most of which are the under 5 children and our pregnant mothers. The path to epidemic is paved with high stakes, and this is where academia must lead. Universities and research institutions are the engines of innovation. From developing next generation vaccines and diagnostics to modeling transmission patterns with innovative research and to training the next cadre of public health care leaders. Our lecture halls and laboratories are the frontline trenches in this fight. Accelerating malaria elimination through academic innovation is more than a theme. It is a call to action. It asks us the following questions. How can our research move faster from the bench to the community? How can our students become advocates, not just scholars? How can interdisciplinary collaboration break the silos that slow progression? Today, we affirm that knowledge is not enough unless it is applied. That excellence is not enough unless it serves, and that faith in progress must be matched by diligence to achieve it. So today, we have invited seasoned professionals as panelists to put together and to spark up ideas, partnerships, and resolve needed to relegate malaria to the history books. So, I implore you to sit and enjoy each moment of this discussion as I declare this colloquium open. Thank you and welcome.
Distinguished ladies and gentlemen, you can join us in our hands together for our good Vice Chancellor. Without taking much of your time, we'll go straight to a good message from Dr. Betty Agala. And because she's wearing a double cap representing the Deputy Governor, Dr. Banetti will be representing how to take a good message. This join us wonderful hands together for Dr. Banetti.
An abridged citation of Dr. Betty Agala, MBBS, MHDGN, MPH, MWACP. Dr. Betty Agala is a distinguished public health physician and visionary leader, currently serving as the Executive Secretary and CEO of the Rivers State Contributory Health Protection Program. With extensive experience in clinical practice, health policy, and administration, she has consistently championed initiatives that advance maternal and child health, preventive health care, and equitable access to medical services. Her leadership in the Medical Women's Association of Nigeria, both at the national and state levels, underscores her commitment to mentorship, advocacy, and empowerment of female medical professionals. While her innovative approach in health financing has strengthened River State's health system to ensure affordability and inclusivity. A recognized thought leader, a social entrepreneur, and and sought-after speaker, Dr. Agala bridges policy and grassroots engagements through initiatives such as statewide health insurance campaigns and community health programs under MWAN. Her contributions have earned her numerous accolades, including the Dr. Irene Ibodaro Prize, the Roll of Honor Award from the Nigerian Medical Association, and the Public Health Icon Award. Beyond her professional endeavors, she is a devoted wife, mother, and Christian whose integrity, humility, and dedication continue to inspire peers and the next generation of healthcare leaders, fostering a vision of a healthier, more equitable society. Ladies and gentlemen, please welcome Dr. Betty Agala, Executive Secretary and Chief Executive Officer of the River State Contributory Health Protection Program, to the 5th Malaria Annual Health Colloquium, our distinguished co-convener.
Thank you very much. I want to start by saying thank you to the Executive Secretary, River State Contributory Health Protection Program, our Honorable and Strategic Leader, Dr. Betty Agala, for giving me the opportunity of being the ES for some minutes. Thank you, ma'am. Her Excellency, Professor Odu, the Deputy Governor of River State, distinguished representative of River State University, the digital VC of River State University, the esteemed colleagues from the health sector, development partners, academia, and stakeholders, ladies and gentlemen, I want to say welcome to you all. It is with great pleasure and a deep sense of purpose that I welcome you all to the 5th Malaria Annual Health Colloquium here at River State University. This gathering comes at a critical time. Malaria remains one of the most persistent public health challenges in Nigeria and across sub-Saharan Africa. Despite decades of intervention, it continues to affect our most vulnerable populations, particularly children under 5 and pregnant women. The burden is not just clinical, it is economic, social, and deeply systemic. That's why the theme of this year's colloquium, Accelerating Malaria Elimination through Academic Intervention, River State University leads, is both timely and strategic. We are here because we recognize a fundamental truth. Sustainable health outcomes are not achieved by policy alone, nor by clinical care alone. They are achieved at the intersection of evidence, systems, and leadership. Universities play a pivotal role in this intersection. They generate the evidence, train the workforce, and shape the thinking that drives long-term change. When academia aligns with government priorities and implementation platforms like RIVCHPP, our agency, the result is not just dialogue, but impact at a full scale. At RIVCHPP, our mandate is clear: to provide financial risk protection and ensure that every Rivers resident can access quality health care without suffering financial hardship. In doing so, we have seen firsthand how malaria continues to drive healthcare utilization, household expenditure, and system pressure. This is why malaria elimination is not just a vertical priority, it is central to achieving universal health coverage. Through our programs, we are not only expanding coverage, but also strengthening access to essential services, including diagnosis and treatment of malaria, especially for vulnerable populations. However, we must go further. We must shift from managing malaria to eliminating it. And that requires 3 things. First, evidence-driven action. Research must inform policy, and policy must translate into implementation. Secondly, institutional alignment. Governments, academia, and partners must move in a coordinated and deliberate manner. Thirdly, sustained financing and innovation. That's where we come in. Without this, even the best strategies will fail at scale. Today's colloquium provides a platform to interrogate these issues, share insights, and strengthen the partnerships required to accelerate progress. Let me commend River State University for this leadership and for positioning academia at the forefront of this fight. Also acknowledge our partners and stakeholders whose continued support makes initiatives like this possible. As we engage today, I encourage us to be practical, to be bold, and to be solution-oriented. The conversations we have here must translate into measurable outcomes in our communities. Malaria elimination is achievable, but it will not happen by chance. It will happen by design, through deliberate collaboration, disciplined execution, and sustained commitment. On behalf of the Rivers State Contributory Health Protection Program, I warmly welcome all and wish us a productive and impactful colloquium. Thank you very much.
Today we have with us, I'm so sorry if I don't pronounce any names correctly. We have with us Aniaba Jane Bob-Manuel, Social Behavior Change Communication Specialist representing the Permanent Secretary, Ministry of Health. We also have with us today Obina Cornelia Chioma, the Rotary Club of Greater Port Harcourt, Rotary International District 9141. We have May Wari Ibisubara Jomo, State Chairman, Association of Female Medical Laboratory Scientists of Nigeria, Rivers State. We have with us Tina Ada Anyawo, the Director of Nursing Sciences, Rivers State Primary Healthcare Management Board, DNS Eli Achise Donkes. We also have with us Eliabo Faith Africa Initiative, NGO. It's Dr. Eliabo Faith Ellison. We have also Ogadi Ni, RSU Business School Administrative Officer 1. We have with us as well Ibotinika D. Kalio, Nigerian Red Cross Society Port Harcourt, Malaria Focal Officer. We have Professor Scott Bernard Akila, HOC Ahuda Campus, RSC. We have Right Honorable Eminike Azunwo Precious, Deputy Speaker, Student Representative Council, SUG, RSC. We also have Edorobi Emmanuel, representative of Abia State University Medical Students Association and Give Hope and Revival Foundation. We have Dr. Barimel Dimpa, Head Health Services Department, RIVCHPP. Yes, I think that is all we have. And then everyone, of course, I need to tell a warm welcome. Thank you, everyone.
I also see my brother and friend, let's celebrate the past chairman of PSA. And as his colleagues, he's also a big boy in welcome, sir. Also, MLS Mogo Precious, chairman, Young Medical Laboratory Scientists of Nigeria. He's here. Thank you. Alright, Dr. Betty Agala has been the support, and it's only wise for us to honor her today. And I would want to do that honor myself. So please let's celebrate Dr. Betty Agala. She makes her way to the podium for her award. Let's celebrate her now. Provost to join me. Let's celebrate our Provost. Thank you very much. So this Professor Sir will help us to present this to Dr. Fetty Akala.
On behalf of the ERENS EKPRIKPO Foundation, a word of appreciation presented to Dr. Fetty Akala, Executive Secretary, Rivers State Contributory Health Protection Program, with deep gratitude for your continued support to the annual Malaria Leadership Team RIVCHPP and dedicated service to the people of Rivers State. Your contributions advance universal health coverage and has led our shared vision of ending malaria, presented to you this day, the 4th day of April 2026 at the 5th Malaria Annual Health Colloquium in Rivers State. Congratulations.
We will now get ready for the keynote address, but let me hand over to my boss.
Alright, distinguished ladies and gentlemen, I don't know whether you are not excited being here today to learn and also to combat that little parasite ravaging Africa. I discovered that malaria treatment has been over 300 years, and since 1880 when it was discovered by Charles Louis, a French army soldier, it has been a problem for us. We want to take the keynote address, but before the keynote address, there's going to be a presentation of a award that will be taken by Dr. Rhoda Awolese Mamikmi, the Department of Medical Microbiology, Faculty of Medicine, Rivers State University of Science and Technology. Please join me, welcome her to the stage as she presents the award to the keynote speaker, Professor ELIMINATION. Please can we just forward while she will take the award presentation. So please do get ready for the presentation immediately after the award presentation has been done.
This is an award of excellence presented to Professor ELIMINATION, keynote speaker of the 15th Malaria Annual Health Colloquium, in recognition of your inspiring keynote address, distinguished scholarship, and exceptional leadership. Your advocacy, mentorship, and commitment to health education continue to illuminate the path towards malaria elimination in Africa. So this award is presented on this day, 24th day of April 2026. Congratulations.
To the many places that I've never been. Remember this, I'm a king, I'm a legend in the making, I'm a champion.
Alright, distinguished ladies and gentlemen, it is an honor and privilege to recognize the presence of Dr. Tare Marcella Joshua, the head of Department MLS, Bayelsa State University. Please jump us for us together as we recognize.
An abridged citation of Professor Ipinabo Laura Oboru, MBBS, MPH, FMC Path, DIPRC Path, UK, DIPC in view. Ipinabo Laura Oboru is a professor of medical microbiology and parasitology and Dean Faculty of Basic Clinical Sciences, River State University. with over 18 years experience as a clinical lecturer to both undergraduate and postgraduate students of medicine and surgery, nursing, pharmacy, medical laboratory sciences and public health at the University of Port Harcourt, River State University and Pamo University of Medical Sciences. She currently serves in various other administrative capacities, spanning membership of the Senate Research Ethics Committee of the River State University and at the River State University Teaching Hospital. She is head of Molecular Laboratory, focal person and co-chair Infection Prevention and Control / Antimicrobial Stewardship Committee and chairman Research and Ethics Committee. She is a fellow and examiner of the National Postgraduate Medical College of Nigeria with about 12 years experience as consultant clinical microbiologist at the University of Port Harcourt Teaching Hospital and now River State University Teaching Hospital, during which she has trained various resident doctors who are now specialist consultants. She has received certified training in leadership and management from the University of Washington and ASCON, Nigeria. Operational quality management in clinical laboratory from the University of Washington. Antimicrobial susceptibility testing and interpretation from the University of British Columbia. Malaria from Harvard X. Good clinical and laboratory practice from Global Health Network and CITI Group, and infection prevention and control from the University of Lagos, amongst others. Professor Oboro's research spans healthcare-associated infections / prevention, opportunistic infections, antimicrobial resistance and stewardship, amongst others. She has successfully led and participated in research teams and technical working groups, including Pfizer-sponsored International Antimicrobial Testing Leadership and Surveillance Atlas Program, Novartis-funded management of malaria in African countries, a multi-center prospective non-interventional cohort study and TED Fund-sponsored study on mupirocin and methicillin-resistant Staphylococcus aureus carriage among healthcare workers in southern Nigeria, molecular epidemiology and characterization. The research and clinical experience derived through many years of mentorship during her residency training, over 12 years of experience post-fellowship, and a Master of Public Health program has further strengthened her research management and implementation capacity. She is the pioneer editor-in-chief of the African Journal of Research in Medical and Health Sciences, published by Medical and Dental Consultants Association of Nigeria, River State Government Hospitals, as well as member editorial boards and reviewer for international journals. She functions in various leadership roles in her professional and religious organizations and is a member of various professional bodies, including the American Society for Microbiology, Association for Professionals in Infection Control, College of Nigerian Pathologists and Clinical Microbiology, and Infectious Disease Society of Nigeria. Ibinabo Oboro is passionate about prevention and control of infections, antimicrobial stewardship and quality management systems, and is known to drive continuous quality improvement. She is amiable, pragmatic, may be described as near perfectionist, and is happily married with 4 children. Ladies and gentlemen, please welcome Professor Ibinabo Laura Oboro, our esteemed keynote speaker for the 5th Malaria Annual Health Colloquium on the theme Accelerating Malaria Elimination through Academic Innovation. River State University leads the way.
Thank you very much. Her Excellency, the Deputy Governor of River State, Professor Ngozi Mahodu, can be represented by my own sister. And did you know my classmates, Dr. Betty Agala. The digital and very ideological Vice Chancellor, Professor Zen, OPP, ably represented by my sister as well, the Dean of Basic Medical Sciences, Professor Fortune Amataria, all other distinguished members of the high table, heads of campus present here at order, deans, directors, professors, community-based organizations, other professional organizations, our staff of Rivers State University, students, ladies and gentlemen of the press, and all other dignitaries here present, good morning and welcome to the 5th Annual Colloquium of the ERENS, the EKPRIKPO Foundation. I'm happy to give this keynote address this morning, which is on the topic, Accelerating Malaria Elimination Through Academic Innovation. Rivers State University leads the way. My sincere apologies go to the leader and complete team of the ERENS EKPRIKPO Foundation, the very, very committed brand new Dr. ERENS actually, we're still celebrating that doctorate. Thank you for being consistent in this fight against malaria. Thank you also to the co-convener, the Rivers State Contributory Health Program, for making this thing happen. Thank you for this privilege to have me speak. I'll be taking our discussion through these few topics. Malaria is something we all know. I'm sure if I ask any one of us to give a talk on malaria, you'll probably say almost everything I'm going to say here this morning, because it's not new. Malaria has been here for decades. Malaria has been here, has probably killed more people than even other forms of, illnesses, war injuries, and all other causes of death. Malaria has continued to remain with us. It has seemed to defy a lot of the efforts we have been making and continues to just persist. But is there an end to it? That's what we're going to talk about this morning. Is that possible? And is it happening? And is it going to happen? That's what we're going to talk about. So malaria is a life-threatening febrile illness, predominant in tropical countries, and Nigeria leads that statistic. It's transmitted by the bite of an infected female Anopheles mosquito, not by, being overworked, not by being too stressed, not by taking too much of palm oil or oily foods, not by being close to somebody who had malaria, not because your brother or sister had malaria, so you have to have malaria. It has to be by the bite of an infected female Anopheles mosquito that is known to characteristically be a dusk to dawn feeder. So she's not the mosquito that feeds in the morning or afternoon hours. She feeds from the evening through the night to very early in the morning, and then goes out to breed her offspring. Usually they love to be indoors so they can feed, and then they go out to breed. Other transmission routes by which malaria can be got is by blood transfusion. So it does happen when an infected person donates blood, and that blood is transfused. The blood stage parasites can be transmitted to the recipient and cause malaria. It can also be vertically transmitted. So a mother who has malaria, can easily pass it, to the baby, as well as also, come down with various complications because of the presence of malaria. In fact, there is our Anopheles mosquito. So there are about 5 species of the etiologic agent of malaria. So the mosquito is the vector that carries the parasites in its proboscis and transmits it when it takes a bite. Now, what it transmits is either one of these species, and Plasmodium falciparum is by far the most common in Africa and in sub-Saharan Africa in particular, and Southeast Asia. Plasmodium falciparum is the big, and the notorious member of that family. It's the one associated with severe forms of malaria, and it's the most predominant form we have around us. So, from a lot of studies, usually between 95 to 99% of malaria infections around us here in Nigeria are caused by Plasmodium falciparum, sometimes in combination with other species sometimes just alone. So that schema shows us what we found out in 2021 when we did a survey across 3 southern states. We found out that P. falciparum actually was the most predominant of all species identified. So globally, as at the last World Malaria Report, we had 282 million cases of malaria recorded across the globe. But the WHO African region, within which we lie, contributed 95% of that amount. So 265 million cases came from here. And you know that this must be an under-reporting, isn't it? Most cases of malaria around here are not even noted. They're not recorded, they're just managed at home and around us. And Nigeria alone, in the giant of Africa, contributed more than a quarter of that number, 31%. The last World Malaria Report before that put us at 27%. So it looks like we're not doing well in Nigeria. Who are those at risk, most at risk for malaria? Children, infants, 1 and then between 1 and 5, are quite at risk of the most severe forms of malaria. Pregnant women and girls tend to come down with malaria a lot. And let me make a joke here. I heard this analogy from a professor so many years ago when she was talking about malaria, and it made so much sense. So we said the Anopheles mosquito feeds from dusk to dawn, isn't it? And so usually when people go out on dates or go out for dinner in the evenings, what do the men usually wear? They wear a suit, they wear trousers, they wear socks. They're covered. All that is left open is probably their face and their hands. But what do women wear? We go out almost naked, right? So mosquitoes have a lot of room to feed on. And that's no wonder females usually are more culprits than males. Yeah, non-immune travelers, so someone who hasn't been exposed to mosquitoes as much as those of us who are around here have, that comes over to our country will not have enough immunity, and so will come down with severe forms of the disease. People with HIV and AIDS have an impaired immune system, and so they are particularly at risk. So malaria is noted as one of the opportunistic infections that happens in people with HIV. So this just shows us the percentage, prevalence of malaria that we identified in the study I talked about across Delta states, River states, and I can't quite remember the third. Now was Delta, Rivers, and Imo. Sorry. So those 3 states were assessed back in 2021, and we found that out of 2,820, women, pregnant women in particular, who were taking samples from and examined by microscopy and rapid diagnostic testing. We found just a small percentage parasitemia, 6.8% by RDT and 6.7% by microscopy. So that made us begin to think, those very high figures that are reported, are they really true with what happens around here? So we were confident at that point, this was an NBDC-sponsored study, to report that truly we seem to be doing well with control, but it seems that the bigger picture doesn't tell the same story. Current data doesn't tell the same story. Same thing happened with the children in those 3 states. Sorry, that was Akwa Ibom State, Akwa Ibom, Delta, and Rivers. We had 8.6% and then 7.4%, by microscopy. So those were low figures. And these measurements and examinations were done rather by trained microscopists. So it wasn't a function of all laboratory practice. So malaria, this is a schema that I like. Okay, so clear there. But it's something that is recorded in Nature Reviews, and it tells you about the life cycle of malaria and of the Plasmodium parasite in particular, and then tells you about the impact. And you can see that when someone comes out with malaria, it affects virtually every part of the body. So major organs bear the brunt, from the brain to the liver, the kidney, they bear the brunt of this. The placenta and pregnant women also, and then of course the hematologic system. So blood levels are affected when we know that all of this put together can lead to very devastating complications that can lead to death of the patient. Pregnancy and fetal outcomes. Pregnant woman who comes out with malaria could have very low blood levels, anemia, which can impact her baby. Baby comes down with very low birth weights if they are born, and sometimes it can even lead to, spontaneous abortions and lead to, growth retardation of the baby while in the mother's uterus. It causes a lot of economic impact. Lots of, work days and hours are lost. Lots of time that should have been spent, gaining income is lost. I mean, who has ever had a true case of malaria here? Can I see your hands? You understand what I'm saying? It keeps you down for as long as you are ill. So economic impact is huge. Mortality is huge as well. And that is biggest among children. 610,000 malaria deaths in 80 countries happened in 2024. And then the WHO Afro region contributed 95% of that number, with children under 5 contributing, 3/4 of that figure. So you can see that children, probably because of their inability to speak out when symptoms begin earlier, probably the inability of that rural woman who is not empowered, doesn't have money to access healthcare and has to wait for her husband who has gone to work somewhere that requires him to be away for 3-4 days, has to wait with malaria symptoms and present when it's either too late or never get to present because they die in their homes. So children bear the brunt, and it's our duty to protect them. And so we talk about malaria elimination. Initially we talked about control, and then we moved on to elimination in an attempt to achieve eradication. So when we talk about control, I mean that's what we focus now. But it just means bringing levels down to bringing the incidences, the number of cases of malaria down to a level that a geographical region can manage. Okay? But we've gone past there. Now we're talking elimination. And that's a process that goes from pre-elimination to elimination and then ultimately probably to eradication. So when you talk about pre-elimination, you're referring to a case where you have less than 5 cases of malaria caused by one of those species of Plasmodium I talked about within a specified geographic region. Okay? And then of course when you achieve elimination, it means there's zero transmission, meaning there are no cases of a specific species of Plasmodium causing malaria within a geographic region for at least 3 years. And between 2010 and now, about 47 countries have achieved elimination. Why can't we do it in Nigeria? When others are achieving that, why are our numbers increasing? And then, of course, when you achieve elimination, you want to take active steps to prevent reintroduction, because remember, other geographical locations will still have malaria being transmitted, so it's possible for it to be imported. Okay? But eradication means that all across the world, there are no cases, so there's zero transmission of malaria, and at that point, you don't need to make efforts to prevent reintroduction. So this, maps just show us in green the parts of the world that have achieved elimination. Can you see Africa? Can you see how bare Africa is? Meanwhile, we bear the brunt and we seem not to be achieving anything. This is Africa. Totally still there with high burdens of malaria. So just to say that controlling and eliminating malaria is in line with the Sustainable Development Goals. And we know that our digital Vice Chancellor is big on our research being tailored towards achieving and solving some of the challenges that are associated with the Sustainable Development Goals. So I want to encourage us to drive in this direction. You will get support, you will get funding, you will get accolades if you push towards malaria. Now, World Malaria Day 2026 is one of the series of World Malaria Day celebrations that are done annually on the 25th of April, to bring the world's attention to this continuous problem of malaria and draw attention to possibilities to end this scourge. In fact, it said that in the First World War, malaria killed more soldiers than war injuries, and it's still killing our babies. I joke with my students, I say, before now we used to say malaria kills a child every second. Now we're trying to pat ourselves on the back and say, now it kills one child every 2 seconds. Is that a better thing to say? Do we prefer killing a child every 2 seconds? Great. So we can see that, yes, many parts of the world are achieving. This is the theme for the year, driven to end malaria. Now we can, now we must. 37 countries have reported fewer than 1,000 cases in 2024. 47 countries have been certified malaria-free, and 610,000 deaths still occurred in 2024. Where are we in Nigeria? So, of course, we know that as an institution, Rivers State University, as a tertiary institution, has a mandate of training, teaching, research, and service. So as we go on in this discourse, I want us to think. I'm probably going to be leaving you with more questions than answers. I don't have a magic bullet for us this morning, but I'm going to encourage us to think about how in our own sphere, and I'm happy to see many organizations represented here, how in our own little areas we can contribute to ending the scourge of malaria. The World Health Organization, through its global malaria program, has identified these 5 domains, for effective, drive towards elimination, and have highlighted accelerating innovation, because that's what our talk is, focused on. We must accelerate. We shouldn't lean back, rest on our oars. We must push. We have lived with malaria for way too long. And I'm happy to introduce the Magic App platform. There at the bottom, you can just type in Magic in capital, App in small letters. It's a WHO platform. Usually you will browse on it for free, but it gives you real-time information on ways you can manage, prevent, and eliminate malaria. So it's a very useful, app. Let's please download it and begin to use it. So, the Global Malaria Program, sorry, I'll take you back there, provides guidance for elimination of malaria towards various means, and they have, as part of, their technical advisory group, have a global technical strategy for malaria, and the current one running is from, 2016 to 2030. We are in 2026. Some of the targets you can see here says they aim to reduce malaria mortality rates by at least 75% in 2025 compared with the 2015 data and so on. Down here, I have the prevalence across years. So 2015, we had 214 million cases of malaria. 2024, we have 282 million cases. Are we winning the war against malaria? Now, the National Malaria Elimination Program, that's domiciled in Nigeria under the Federal Ministry of Health, has also put forth its own vision and drive, and aims to have achieved a lower than 10% prevalence by 2025. That is not the case. We have not gone there yet. This is not a good slide, but I have to leave all this on to show that, so that I can show you the objectives of the National Malaria Elimination Program. You can see in bold the approach by which they aim to achieve elimination is by chemoprevention, diagnosis, and treatment for at least 80% of those of us at risk. Reporting of quality data, collaboration, coordination, strategic partnership, and funding. Most of it targeted at 80% of those at risk. And let me remind us that in Nigeria, malaria transmission is described as hyper-endemic, meaning we have a stable transmission. Every day, you and I will get bitten by at least one infected female anopheles mosquito. So we're continuously exposed. We're continuously at risk. But have these objectives been met? So usually when you talk about efforts towards elimination, you want to take them in 3 different approaches. Vector control in one focus, protecting the host, you and I, and all those in the communities, and then of course elimination of the parasite. Okay, so I'll talk about vector control briefly. What are some things we have been doing and that we should keep doing, and some things we can begin to do? That's going to be the thrust of the remaining part of my discourse. So reducing vector habitats. Her Excellency, Rivers State is experiencing a lot of garbage on the streets. I must speak up about this in this forum, and I'm happy our Deputy Governor is here, ably represented. We have moved from the garden city and we're moving to a point where garbage management is becoming a big problem. And we know that the habitat of mosquitoes is wherever there is a collection of water. And in these pools of dirt, pools of empty cans and containers, anything as little as water contained in the top of a bottle caps, is enough for the female Anopheles mosquitoes to thrive. And so we must keep our environments clean if we must achieve malaria control. The vector habitats must be taken away. So clean environment, so important. And then of course we have our long-lasting insecticide nets, which were distributed free of charge to so many of us over the past few years. But we know that there's a peculiar challenge with that in Nigeria, isn't it? The heat, right? Most people tell you they can't sleep under those nets because the temperatures are too high. So we need to think, is that the best bet for us in Nigeria? Maybe that's why we're lagging behind when others are improving. Because the use of the long-lasting insecticide nets has been noted to be the major contributor to the progress that a lot of countries that have achieved elimination have. So those nets are there, but we have also begun to see resistance to the insecticide that those nets have. Okay? Somebody used to joke that if you use a non-insecticide treated net and your body gets to the edge of the net, the mosquitoes just put their proboscis through the holes and feed. But when you have the insecticide treated nets, it kills them in the patch, or at least drives them away from that area. But there's beginning to be a lot of resistance. And Anopheles, for the entomologists around here, Anopheles defensi has been noted to be highly resistant to the pyrethroids, which are the most common insecticides we have. However, newer models of these nets are being developed, okay? Dual ingredient nets that have a combination of insecticides and other compounds that inhibit the growth and survival of these mosquitoes. And so those are useful. So when we can afford it, please, let's encourage ourselves to use nets, okay? And then spatial insecticide emanators, that's another move that has been made. And I got thinking, what happened to our mosquito coils? You remember them? What happened to them? Are they still available? I don't see them around anymore. Because that's the application of these emanators. They release fumes into the environment containing insecticides that can keep mosquitoes away. So in places where people can't afford to buy morphine and all the other insecticides, I'm sure these will be cheaper. Please, let's go. It's going to be pharmacy now. Those who are responsible for producing those begin to think about how we can bring them back onto the scenes so that we can have more effective approaches to prevention. So I've been asking, do we have data? We don't have data on the predominant species of mosquitoes that's caused malaria recently. If we do, it's important that we share this regularly. It's important that we study their susceptibility to the insecticides. So entomology department, please look at this. And such information should be out there. Nigeria should not be left out in this. Mosquitoes have also evolved. Remember, microbes are beginning to think of how to survive in the face of all the challenges we keep presenting to them. So mosquitoes, the female Anopheles, is noticed to now beginning to bite earlier. So she bites much earlier while you're still, resting, preparing to go to bed, and then she goes out, to breed. So we need to also be careful. So it's not only at bedtime when you get under your bed nets that you protect yourself. In the evenings when you hang around, you sit around, there could also be transmission. So we must also think about netting of doors, think about netting of windows, and protecting our environment from access to mosquitoes. Talking about about diagnosis. I mean, until you make a diagnosis and treat, you may not be able to halt transmission, because that infected person can provide forms to be transmitted to another person. So I'm happy that RSU has a very functional health center. We have the facilities, the personnel, the equipment, and reagents to test for malaria. That's a plus, thanks to our digital vice chancellor and the health team. But we're experiencing diagnostic failure. There are records in about 46 countries, and probably more than that, of resistance to the components, or rather lack of response to the components that the RBTs are supposed to detect. These parasites can show what we call P falciparum, they reach protein 2 and 3 gene deletions, and that impairs RBTs. We know RBTs are important for hard-to-reach environments, communities, places where we don't have expertise, we don't have specialized equipment like microscopes, power supply, and so on. The RBTs do well, but that is being challenged. So can we begin to encourage uptake of laboratory diagnosis? How many of us have been taking anti-malarials without even testing? We have upper respiratory tract infections, we take anti-malarials. That encourages anti-malarial resistance. Can we please, begin to think about, do research onto more, better approaches for diagnosis. Let's think in that way. Remember, I told you I'll have more questions than even answers by the end of the day. Chemo prevention, different strategies are available. I'm not going to dwell on that. But it's noticed that a lot of the preventive medicines are short-lasting. So WHO is asking us to think through and develop more longer-lasting preventive medication. So we can think in that way. Pharmacy departments can begin to think that way. Malaria treatment also is facing its own share of challenges. The common, very safe, very convenient anti-malaria that is proposed for treatment, the artemisinin-based combination therapies, are already experiencing a lot of resistance. And do we have any other drugs to fall back to? We need to think that way. Let us think about new approaches. And most of these anti-malarial drugs come from medicinal products, isn't it? Phytomedicinal products. Who remembers the Madagascar concoction during COVID? A lot of Nigerians, Africans were doing a lot of plant-based, treatments that worked, even though we don't have scientific evidence for them, but they work. So can we begin to put more emphasis into phytomedicinal, research, so that we can develop things? I mean, people tell you things that if you plant there's this plant hospital too far, in your environment, and there's one other one, I can't quite remember the name. Mosquitoes stay away, and things like that. Can we make them more scientific and probably patent some of these things, for use towards local, solutions for malaria control and elimination, okay? So novel drugs, anti-malarial stewardship. Please only use anti-malarials when you have malaria. Not because you feel too tired, not because you have had a stressful day. We abuse it a lot, and that must stop. Malaria vaccines are available. For 2-3 years, the WHO has rolled out 2 anti-malarial vaccines, recommended for use in children, but we have them in country, but they are not yet in circulation. I want to, before this presentation, I had to do a reminder an inquiry from the state vaccine coordinator or so, and he said, they're not yet in use here. So we need to begin to think about them. Accessibility has to improve, so our numbers can go down. Accessibility, will Nigerians accept it? And then the effectiveness, studies of effectiveness. The trials that were done in 3 other African countries, not in Nigeria. How does it work in Nigeria? Do we know? And then, of course, we know that the approach to these 2 vaccines are against the malaria parasite forms, that are injected into the human. Can we also begin to think of other ways we can provide vaccines? I know vaccine studies are not big in Nigeria, but we may be part of research teams here and there, okay? Where we can target all the stages of the malaria parasite's life cycle. That's very important. And then we must give data. Data is important. That's the only way we can know what's happening here. So from every field of management, of diagnosis, of research, let's give data. When we treat cases, we make record. At the end of the year, can we say, go in Port Harcourt, the River State Ministry of Health, and say in all our health facilities, we actually have this number of malaria cases, social number achieved cure, social number, we're probably resistant and things like that. Can we have such data? And that will help us towards elimination. Molecular research is so important. In fact, every country that has achieved elimination took their research, took their diagnosis to the molecular level, because most of the methods we use for parasitological diagnosis don't have very low, don't have the ability to detect very low numbers of parasites. And so if we don't take it down to the molecular level, we might have few parasites in circulation that over time will increase in number and present with clinical malaria again. So we must improve. A lot of our molecular laboratory facilities are under lock and key. Am I right? We must open them up and begin to use them. So I want to encourage us to collaborate. We have so much expertise in RSU and beyond here. Let's work between faculties, within faculties, between specialties. I mean, whether it's social mobilization from communication and media studies, agricultural products from the Faculty of Agri to the medical laboratory science, College of Medicine. Let there be collaboration so that we can reach a goal of elimination. Funding is important, but like I have said, if we push towards the sustainable development goals, funding will be easier to achieve. And I want to encourage the Ministry of Health to please bring down our vaccines to us. I know there are lots of bottlenecks that may be associated, but we can make it happen for the good of our people. So of course, the challenges with malaria elimination are enormous. Biologic challenges which relate to the parasite, relate to the humans who may be infected, systemic challenges which I have talked about as I've been going on, and then humanitarian challenges. Luckily, we don't have too much, except in the hinterlands where we still have a lot of issues with crises, and insurgency and things like that. Okay, but we must, put our efforts into an integrated approach. It's not a one-size-fits-all. Different approaches to malaria elimination must be adopted. And then I came across this study that talked about 5 innovations that would help to eliminate malaria, and I thought to share it. So somebody is thinking of next generation vaccines. Somebody is thinking of targeting the love for sugar by the Anopheles mosquitoes, using them as baits for them to consume poisonous substances that could kill the mosquitoes. Someone is thinking of sterilizing infected female Anopheles mosquitoes so that they are not able to take up babies and continue to propagate. But that may have an impact on the ecosystem. We need to think about that. Somebody is thinking of infecting mosquitoes with the Wolbachia species, which are, endosymbionts. Okay, so they're bacteria that tend to inhabit the guts of, arthropods, mosquitoes, the black fly, and so on. And they are necessary for the survival of these vectors. So, it's possible that if you, introduce them into the mosquito vectors, they may, compete with the plasmodium parasites for survival within the gut of the mosquito, and probably, outsmart the plasmodium parasites and we achieve, lower levels of malaria. So let's begin to think of these tools. The director of the WHO, Dr. Tedros, says with the tools we have available for malaria elimination, nobody should actually be dying of malaria, but we still have people dying of malaria. It still happens. And so we must begin to think of sustainable approaches. Let's stop waiting for the developed world to tell us what to do to control malaria in Nigeria and in Africa. Can we get African solutions? Can we get Nigerian solutions for the Nigerian problem? Can we engage the communities? That woman in your village, that man in your village, does she know that that mosquito bite is what probably is causing that fever? Does she know, how she can prevent it effectively? Does she know that her children are at risk? Community engagement. Do they have plans? Do they have approaches that we don't know out here in the cities that actually are working for malaria control? We must engage the communities. And I want to say that everyone has a role. Like I have mentioned earlier, you have a role to play, I have a role to play. Thank you so much. These are my references. You have a wonderful day. Principal Oboro for this insightful and thought-provoking keynote. One key takeaway from this keynote today is that malaria is not just a health challenge, it's a systemic issue with medical, economic, and societal implications. And so, as we move forward in today's program, we are urged to think about the role we have to play, because just like Professor Oboro said, everyone has a part to play, and so everyone has a part to play. At this point, we'll take a moment to recognize some personalities present with us. I would like to recognize Dr. Amadi Nkemjika, Acting Director, Medical Center, River State University. Pharmacist Anne A. Promise, Head of Pharmacy, River State University Medical Center, Board Member RIVCHPP. Dr. Juliet Anene, Head PRS, RIVCHPP. I'd also like to let us know that the RIVCHPP staff at the entrance ready to enroll people into the state health insurance scheme, and they're also going to be doing NIN registration, so they're just at the entrance. They do well to visit their stands. River State Counseling Association of Nigeria is represented today by Dr. Deoha Patricia and Dr. Juliana Doyi Federico. I'd like to recognize Dr. Barunem Deepa, Head Health Services Department, RIVCHPP. Pharmacist Kanta Roland, State Coordinator, Drug Substance and Abuse Control, River State Ministry of Health. Let's recognize Martins Marvelous, President, SUG. Here with us today is Osinachi Joseph, PROSUG. Irondi Chris Burial Harrod, President, Association of Resident Doctors, River State University Teaching Hospital. Paluku Chukwuka Achonwo, Lead Scientist, Infectious Disease Unit, River State University Teaching Hospital. Secretary, for being here.
Thank you very much. John is one of us together. For our keynote speaker, she did so very well. I learned a lot from our keynote, and it's important for us to understand that malaria has caused a lot of harm and good to us. We want to move straight to the panel session, but before we go to the panel session, we want our distinguished, with kind permission from the Vice Chancellor, we want us to all step to the front seat so that we can prepare for the panel session. Alright, distinguished ladies and gentlemen, sorry we have a little alteration from what we want. While members of the item will maintain their seats because of exigencies, the Deputy Governor of River State, Her Excellency Ngozi Odu DSSRS, wish to take her remarks for this event that is important, ably represented here. So we revert to what we want to do. Please can we just go back? Jam those who have hands together for them after return to their members of the table and the panel session is done. Okay, picture here. So have a picture together as members of the table for the movement. Please, Dr. Abi Ibinabo, Dr. Kwanta, please. Picture session. expected to come. EKPRIKPO, please. Our MLS chairman is also expected to come. Director of Health Services for the picture session. All represented body here, every other director here, please come for the picture session before we go to the panel session. All representation of bodies, head of departments, professors, head of campuses, association leaders, and university and the rest of the place. Association leaders. Okay, that's the wonderful one. I want to go to the panelist session. Maybe. Okay, we want to go to the first panelist session, and it is an honor and privilege for me to welcome the immediate past Commissioner of Health. So, okay, the moderator for the first panel session, and that is nobody but pharmacist Quanta Roland. Please jam your hands together for her while we present an award to her by the convener.
Thank you very much, ma'am. We rejoice to know that this wonderful pharmacist was very much active in this platform last year. Please celebrate pharmacist Quanta Roland. It's a very much dignity to have her here as a moderator today. So on behalf of the ERENS Health Foundation and RIVCHPP, this is a certificate of appreciation as a moderator presented to pharmacist Quanta Roland at the 5th Malaria Annual Health Colloquium. Let's celebrate her.
To be the best, number one and nothing less. Lead me to my destiny. I have waited patiently. I have vision, though I believe. I know I can count on me. So stand up for the champions, for the champions. Stand up, stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up.
Okay, thank you very much. The rostrum to be part of the panel is nobody but Dr. ERENS. Please come to
a brief citation of Dr. ERENS. Dr. ERENS is a consultant, family physician, public health specialist, and the immediate past Honorable Commissioner for Health in Rivers State. Prior to her appointment, she was the Pioneer Country Director of Planning, Research and Statistics for Nigeria's National Blood Service Commission and the Senior Health Policy Advisor with Nigeria's Federal Ministry of Health. With over 2 decades of private and public healthcare experience, she was a member of the Pioneer Governing Council of Pamo University of Medical Sciences, Nigeria's first private university of medical sciences. She is a fellow of the West African College of Physicians, Kofi Annan Global Health Leadership Program, the Aspen Institute, Aspen Global Innovators, the Royal Society of Tropical Medicine and Hygiene, the Royal Group, and the International Society of Blood Transfusion COVID-19 Convalescent Plasma Working Group. She advocates for respectful quality healthcare, health equity, universal health coverage, and quality medical education, and was invited to share her perspectives at the 74th United Nations General Assembly in 2019. In 2021, she was one of the 15 accomplished Amuje leaders in Africa awarded by the Ellen Joseph Sirleaf Presidential Center for Women and Development. Dr. Oro was named a neglected tropical disease champion by the Global First Ladies Alliance and the END Fund, and most recently National Self-Care Champion for Sexual and Reproductive Health by the White Ribbon Alliance. In the same year, she was awarded Best Research Prizes by the International Society of Blood Transfusion and British Blood Transfusion Society respectively for research she led on COVID-19 and blood services. Dr. ERENS is a recipient of the 2021 Montegut Global Scholars Award by the World Organization of Family Doctors and the American Board of Family Medicine Foundation, and has been named one of these days 50 power women in Nigeria alongside Her Excellency Senator Remi Tinubu, Dr. Ngozi Okonjo-Iweala, Her Excellency Amina J. Mohammed, and Chimamanda Ngozi Adichie, and Business Day's 50 Most Inspiring Women in Nigeria. She has written over 125 publications on health systems and policy in peer-reviewed journals and mainstream media, and is the co-author of Lessons Life Has Taught Me and Sickle Cell Diseases in Sub-Saharan Africa. Ladies and gentlemen, please welcome our esteemed panelists in immediate Past Commissioner for Health River State, Dr. Adeze Chidima Ore, to the 5th Malaria Annual Health Colloquium. She will be discussing on the topic, Accelerating Malaria Elimination Through Policy and Partnerships, Reflections from the Immediate Past Commissioner.
To present the award to her is the President, Association of Resident Doctors, River State University Teaching Hospital, Dr. Chris Grew Harold. Please join me for him.
Thank you very much. Your Excellency, the recognition of your outstanding service, visionary leadership, and unwavering commitment to advancing public health in River State. Your tenure strengthened primary health care, advanced maternal and child health outcomes, expanded access to quality services, and elevated River State's voice in the national and global health discussion. Congratulations.
Panelist on the list is my big brother, Abi Tamara. Please join me for the hands together for him. To take the citation, to take the presentation after the citation will be Paluku Chukwuka, Lead Scientist, Infectious Disease, Unit River State University Teaching Hospital. Please can you just step forward?
And a brief citation of Dr. Abiye Tamno. Dr. Abiye Tamno is a specialist public health physician and cardiopulmonary and metabolic physiologist at River State University, Nigeria. His research focuses on various health topics, including cervical cancer awareness, cardiopulmonary functions, and environmental health impact, with publications in reputable journals like the Journal of Biosciences and Medicine and the Open Journal of Medical Imaging. In the realm of public health, Dr. Tamino Obubo has explored the impact of environmental factors on health, including hydrocarbon-based contaminants in drinking water sources and shellfish in the Niger Delta region. His work aims to inform public health strategies and improve community health outcomes in River State and beyond, with a focus on preventive medicine and disease control. As a researcher, Dr. Tamino Obubo has contributed to studies on malaria, emphasizing the importance of effective prevention and treatment strategies in Nigeria. His expertise in public health and cardiopulmonary physiology positions him as a valuable resource for addressing malaria and other health challenges in the region. Dr. Tamino Opubo is a lecturer at the Department of Human Physiology at River State University, where he contributes to teaching and research initiatives. His research has been recognized through publications in esteemed journals, including the Journal of Medical and Dental Science Research and Radiation Science and Technology. To discuss the topic strengthening health systems for malaria elimination, ladies and gentlemen, please welcome our esteemed panelist, Dr. Abiye Tamno Opubo.
At our 5th annual health colloquium, theme Accelerating Malaria Elimination Through Academic Innovation, River State University lead the way. At this 24th April 2026, Chief Barrister Yenson Wike, Senate Building. Sir, congratulations for this.
All right, distinguished ladies and gentlemen, with the next person on the panel is
Faculty of Basic Common Disease Research for Africa and Asia, based in Canada. He is the head of Infectious Disease Unit at the Health of the Sick Hospital, Umpoku, Port Harcourt, Rivers State. A visiting physician with the Rasiela Specialist Hospital, Port Harcourt, Rivers State. A pioneer lecturer established in the Department of Rivers State. He has several publications in national and international journals that has cited over 100 times with a publication H-index of 10. He is a member of several editorial boards and a reviewer of various journals. Ladies and gentlemen, please welcome to the 5th Malaria Annual Health
Elimination through academic innovation versus lead the way. Congratulations, sir.
Thank you very much. Please have your seat, sir. At this juncture, I hand over the microphone to the panelists, to the moderators.
Thank you very much. So we're going to be having a very interesting panel session. We're very opportune to have seasoned healthcare professionals here with us to discuss the issue of the very tiny female mosquito, yet giving a lot of problems to us, as a people. And so we're going to be looking through policy changes that have been made, have been implemented to eliminate malaria in our society. We're going to be looking at health system strengthening, and we'll also be looking at novel treatment approaches to accelerate the elimination of malaria, and also to talk about the issue of resistance. Fortunately, like I said, we have seasoned healthcare practitioners here with us. So without wasting much of our time, we'll get started. So for the panelists, to every question assigned to you, you have just 5 minutes. And when I prompt you to stop, please stop so that we can do it orderly. Alright, the first question presented by Dr. Reggie. As a family physician and a public health specialist, in your tenure as the Honorable Commissioner for Health, what policy changes were implemented? And how were you able to leverage partnerships to support and sustain your efforts? Thank you.
Thank you. Good afternoon, Your Excellency, the Deputy Governor, ably represented by Mark, our keynote speaker, heads of agencies, and associated established protocol. It's an honor to represent Dr. Adeze Ore, who is the 27th Honorable Commissioner of Rivers State, to share her reflections during her tenure as the Commissioner of Rivers State. To strengthen the health care system, and how was that done? There was the impact, and we saw the communities not just as beneficiaries, but as co-implementers of this program.
How do you bring your partnership to be able to support and sustain your efforts?
Okay. She leveraged on partnership. When there were commodities, she reached out to the local government chairman. So she personally sent out text messages to the local government chairman. And because they are aware, there was improved accountability, reduced mismanagement, or reduced corruption in distribution of the commodities at the LGA levels. And also, the civil society were engaged and actively involved in what was happening. So accountability and transparency was the watchword throughout our administration in the state, and we had improved uptake of these malaria services.
I will put our next Thank you very much. The next question is for you, Dr.
Amin, Samuel were together last year, same day. So we're privileged to have you again today. You're going to be giving us insights on how we can effectively strategize to strengthen our health systems. What are effective strategies that can be employed to strengthen our health systems, and how can these strategies be implemented? Thank you very much.
All right, thank you. Talking about health systems, we are actually talking about an all-inclusive thing, where all organizations, people and actions come together with the primary aim of fostering or maintaining health. Now, in doing so, there are very key things we need to do. We must have a good service delivery in terms of provision of effective, safe, and quality health services. That is a key part of it. Health systems are in place and they offer the appropriate commodities to give to the people who are in our communities. Because this whole thing we are talking about malaria, the MC was talking about one tiny thing. The tiny thing dwells amongst us and is worse in our communities. And they are the end users, so we must ensure that there are equitable distribution of these commodities, and they should be quality health commodities. They should be accessible. There should be equitable distribution. It shouldn't be, oh, this one is from this family unit, is in this compound quarrels with us, so we're not going to do this and all that. Everyone should have access to it. And then to the workforce, in so doing, has to have some form of motivation. Like the Sonobi effect, a rebound effect, where, it comes back to the community. They are better than what they have in terms of service. And then the other issue around the other issue is in terms of access to essential medicines. I've talked about it. We should have availability of safe, effective, and affordable medicines. Medicines should be affordable. Those drugs that we give out, how much of these do the communities have? They say, oh, malaria drug is free, RBC testing is free. Is it actually free? The health worker, don't they sell it to them? Don't they take money in lieu for all that? These are key factors. Then the major point is health financing. Health financing is key. We should ensure people can use services without financial hardship. So policymakers, government at all levels should provide adequate funds for the sustainability of this control programs or regulation programs. And then that brings it to thank God the RIVCHPP executive secretary is here. Yes, I'm almost done, sorry. And she's here. That brings about health insurance. And I know she's doing a lot of this. These things are critical issues that needs to enhance all that. And then leadership and governance, policy, good policies, regulations. Thank you.
Thank you very much. Thank you very much. Dr. Malcolm to exhaust all. I have so many questions for to respond to. Thank you very much. So we're going over to Dr. Christian right away. You please, with your wealth of experience, you will share with us how you think we can optimize treatment at home and how we can mitigate malaria drug resistance, anti-malaria drug resistance. Thank you.
Thank you very much. Before I answer the question, I don't have a limited time. Just want to thank the organizers of this program. And they've done wonderfully well to put this program together. One major takeaway we should go home with, just as one of the speakers said, it's not that malaria is too tiny, but as tiny as the parasite is, it is highly devastating. The devastating nature of this can be quantified when we put together the cost of care in treating malaria. Today, as I speak, most of us know the cost of getting one capsule or one pack of water, which is an ACT that is used. And when we quantify that, it will tell us the enormity and the reason why we are all seated here to discuss the tiny subject matter, which is malaria. Now, to answer my question, it is simple. There is high level of resistance as we speak. The primary bottom line of this resistance is stemmed from the fact that for diagnosis and treatment when it comes to the issue of malaria, everybody treats everything as malaria. In fact, you cannot pass your exam, the first thing you do to treat for malaria. You cannot understand the subject matter, you treat for malaria. The lecturer is teaching and you are not understanding, they say malaria is coming to you. The beautiful part of it is that when you have a dream, they tell you that go and take for malaria, how can you buy the disease? Who is telling you that you buy the disease is malaria? Having said this, we are always treating malaria where it is not necessary. How is it pharmacologist? There are terminologies we use to tell us why drugs are not work. We have three important terminologies. We have what we call tolerance, we have what we call tachyphylaxis, and we have what we call, the best one I will not say because of the number of persons. Now what is tolerance? Simply put, tolerance is reduction in the responsiveness of the drug following repeated administration. What does that mean? It tells you that when you take a drug, the tendency for the drug to act reduces. Now, when it comes to the issue of malaria first of all, there are various mechanisms that have been stated to create resistance, and these are factors that I know, which I'm not going into details because it's not my scope. There are various mechanisms that have been known. Now, how can we optimize care and reduce resistance? Simple. Testing, testing, testing. When you go through the cases, you discover that it takes a lot of years, it takes millions of naira. So what do we do as of today? We do what we call drug repositioning, drug repurposing. And what is drug repositioning and drug repurposing? Drug repositioning and drug repurposing, simply put, is a process whereby a drug that's already known, that's already in use, that the efficacy, the safety profile of the drug has been well established, but that drug is used primarily for a condition, you transfer the use of that drug to another condition. And they take care of complete cure and elimination of the parasite. And what are those drugs? One, ivermectin. Combination of ivermectin with an ACT gives you better therapeutic profile than using an ACT alone. Two, ketotifen. Ketotifen is an anti-allergic medication that can be shown when you combine it with an ACT, gives you a better position. Three, nitrofuran. Four, doxycycline. I'm just trying to use my time because I would have gone into. Four, doxycycline. I'm just trying to use my time because I would have gone into various processes that have been done. Like nitrofuran. She's telling me my time is up. Maybe 5 hours time. I'm not continuing.
Yes, so thank you very much for that very useful information you gave to us, Dr. Christine. And for me, I think what Dr. ERENS has said is all the MC. They were not just here to commemorate this day, they were here to learn. We're here to see how we can, bring ideas together and how we'll be able to go and work. I would not completely agree that drugs are not produced in Nigeria because we still have local manufacturing pharmaceutical companies that are producing drugs, but the raw materials are imported. Now, as Africans, if we look back to what even the keynote speaker said, when you were sick back then, there was no ACT, but your grandma would just go to the back and pluck something and give to you. Boil it, and once you drink it for 3 days, you're fine, right? When we look at most of these medications that we use in the treatment of chronic illnesses, their source is from where? Medicinal plants. So we have work to do. As academics, we have work to do. As healthcare providers, we have work to do. As students, we have work to do to engage in translational research from the bench to the bedside. So it's a challenge for us all here, so that tiny mosquito will let us be, and we'll have something to eliminate, and not just
eradicate malaria in our society. So the next question will be going to immediate personal commissioner for health, Dr. Adeze Chidima. How, in your tenure as the commissioner, how were you able to engage stakeholders? Sorry? How were you able to engage stakeholders in malaria elimination programs? Let's hear how you were able to do that. I know in the first question, and that's basically what all of the panelists are doing. You are exhausting all that you would have answered, but you can still repeat yourself. How were you able to engage stakeholders to eliminate malaria? What were the malaria control programs you had? How did you engage stakeholders? Let's just share from that experience again. Thank you.
Like I've ever answered, there were stakeholders in town hall meetings, CEOs, community-based organizations, and because they were actively involved in the malaria elimination program, they were able to carry this message down to the grassroots, and they were also able to implement behavioral change in different communities where they run their programs or where they have their secular influence. Then everyone also said, she sent text messages. She was able to reach all the 23 local government chairmen, telling them that, oh, the World Bank commodities, impact presents in commodities have arrived. And because they were aware, there was increased accountability and mismanagement of those commodities was greatly reduced. And in her time also, there was collaboration with the malaria program and the malaria steering committee and technical working group, where they collaborated together to ensure that their goals and objectives align together.
Thank you, thank you, thank you very much. I will put our hands together for her. I will put our hands together for her. The next question goes to Dr. Ame Tamro. You know, we are all from communities. We left our respective communities to be here. And so as we leave this place also, we're going back to our communities. So do you think the elimination of malaria should be left just in the hands of government? And if not to be left in the hands of government?
With this term is appropriate stakeholder engagement. That is key. This stage, like I said, the endemicity of malaria we talk about is at that level. So stakeholders should all be community leaders, CDC chairmen, women leaders, youth leaders, all. In fact, in the primary healthcare structure in River State, there is even a community-based health committee. There's a facility-based health committee. They partner with the healthcare providers in their communities. Those are the primary healthcare level and all that. There is a need for governments to give them their right of place, to make them have sense of belonging in terms of regularly being in attendance at such meetings, call for the meetings, engage them. If they know that they have key roles to play in clearing their environment, in accepting the use of insecticide-treated nets, government providing it, these basic preventive tools, if they are made available, and then they enlighten them, teach them, the community leaders how to do it, they will in turn, like train the trainers, train the people within the community on what to do, the essence of this malaria control activities they need to do. So, when that is done, community will buy in. They will own it as their own. They will own it as their own. So that's one way we can involve the community and all that. Then social mobilization is key too. Social mobilization in terms of, forming, even if it's malaria detectors. I know there is a TB, there is cough detectors in our community. There whereas they should involve members of the communities across the different age grades and different groups to identify those persons that have febrile illnesses, 1 or 2 telltale signs that will identify those persons that are ill and bring them to the health hospital for them to be sorted out. You know, these are so many others for want of time will address some of these issues.
Thank you very much. Let's go to our next prayer for me. Remember back then, even this morning, the keynote speaker told us that Rivers State used to be a garden city, right? And right now, we're seeing what is happening on the media. You're seeing unsightly things that you shouldn't see. So, and go back to our communities. Government provided a insecticide treated net. What do we do with it? We use it for our farms. Have you seen it? Yes, they use it for farms in our communities. So if there is community ownership of these programs, that will not even happen. Communities can mobilize for their community members to have sanitations. All of these will take mosquitoes away from our environment. The next question is going to Dr. Christine. How do you think we can employ pharmacology and therapeutics to address the issue of anti-malarial resistance? And how can we mitigate the impact of resistance? Thank you.
This question is almost similar to the first. There is no difference between this and the first question asked. Just to add 1 or 2 things which I already said, it's nothing new. The keynote speaker, my team, did a very wonderful presentation when she goes through the burden of malaria as regards the number of persons affected globally, including in Nigeria, available deaths. Now, this brings to bear the particular age groups that are evidently affected, i.e., children which are under 5 and the pregnant women. The reason I'm doing this is because I'm a teacher and I know there are students, so I'm taking my time to pass the message so that we go home with something very meaningful at the end of the day. Now, when it comes to pharmacology, what pharmacology is simple put, pharmacology is taking raw materials and transforming them to drug for therapeutic purposes to solve problems. Now, with respect to malaria, as we have known, there are a lot that have been done to aid or minimize the burden of this wonderful thing we are all gathered to teach. One of it is, currently, is the vaccine that have been available, which was already elaborated by the keynote speaker. Now, the vaccine that is available, which is R21-M, is being done as what they call the pharmacovigilance study, which is a phase 4 study. Now, what does that mean? The drug has been produced, and gone through all the trial phase, to the clinical to the clinical, and this drug now is in the market for use. But they don't want to take it to the market for us so that all of us will not start using it and will come down with all those side effects that we are not affected during the course of production, as seen in thalidomide. Now, in Nigeria, the vaccine is currently in use. In fact, as I speak to you, about 1.2 million persons have received this vaccine in Nigeria. It is being used in 2 states as a trial studies, which are Bayelsa and Ondo states. Bayelsa and Ondo states currently are receiving this vaccine, and about 1.2 million persons have received the vaccine currently as we speak. Now, what is the aim of this vaccine? What is what the pharmacology does as asked? The aim of this vaccine, and what we know what a vaccine is when you take it, it produces antibodies against the disease, so that when you are infected by the disease, in this case, the malaria parasite will not come down with infection of the disease and the manifestation of it. So once we take this vaccine, there is high tendency that will not go up every day to come down with issues of treating malaria every day. Just like currently the HIV vaccine 2 has been produced. And these are all pharmacological workers who work well on the context of the question. To mitigate resistance, as a pharmacologist, what do we do? It's all about collaboration. It's all about education. It's all about doing the right thing. And what is the education? All stakeholders, not just pharmacologists, all stakeholders in the health sector must be properly educated and trained on the management of the malaria itself. I.e., we should be able to know how do you make a diagnosis of malaria. How do you treat and how do you prevent? And you share this with your patients, not only with respect to what an individual comes to you and say, I have malaria, the next thing you are doing is giving medication. The more you give medication, the more the parasite produces mutant genes that create resistance. So this is one. Two is interdisciplinary collaborations to research. Interdisciplinary collaboration to research brings about new inventions and innovation, which is what has been done, I have said before, which is the drug proposing. Moving the trend for ACT, which is a biotherapy, combination of artificial and infantry, to what is being practiced today, the triple regimen therapy for the treatment of malaria. And this triple regimen therapy, as I said, it is not easy to produce a single drug. These drugs we are taking, paracetamol, vitamin C, took years and billions of naira. When you talk about the preclinical and clinical studies for drug development, it takes a lot. For you to not come down to produce a new drug for the treatment of malaria is tough and difficult. So new innovations now comes in. And what are those innovations that said is the triple regimen therapy, which is being practiced today and are being used. I've given you some Centura, for example, that we combine with the ACT. I can still give you more. We have the acetylomycin, we have the clindamycin. You can combine the clindamycin with sulfadoxine carabinamine, which is what we call the fancier. You can combine your acetylomycin, you can combine your doxycycline, ivermectin, nitrofuran, which are antibiotics like today, and all these can help you in the management of malaria. It has been shown, research has been shown and well documented, that individuals that take this triple regimen, in particular doxycycline, in fact, it's practice. When you treat the patient for malaria and come down with resistant malaria, i.e., it's not to go further, add a simple doxycycline to this management, and that can be used. It is well documented. The only aspect that pharmacology is doing now is in the sport body, which is
Government released funds in sincerity provided this response, how much of this funds gets to the primary health care centers where they are supposed to be domiciled, implemented? How much of it? It's only data that will let us know these facts. So data is key in nipping malaria in the bud. Data is key in helping us to plan to revamp this scourge called malaria. Data is key to help our people come out of this quagmire. Data and data is the stop codon for malaria prevention elimination. Thank you.
Thank you very much, Dr. Now we have my first request to say that data is life. Data is life. So please, we have a lot of work to do, not to put up data, but data that is credible, data that has integrity, verifiable data. All right, so the last question will go to you, Dr. Christine. As healthcare providers, how do you think we can collaborate to eliminate malaria? And looking forward, as an institution, as a university institution, as an academic institution, what contributions do you think we can make in eliminating malaria? Thank you.
Thank you very much for this question. I will start with the last. As a university institution, what can we do to eliminate malaria? One of the things we have to do is what we are doing today. Defeat malaria globally. We are all gathered here today to brainstorm, to discuss, to share ideas, to know the current trend and innovations in malaria. This, by the time we live here, majority of us will become ambassadors, will become champions, will be able to tell the world and tell people what is malaria, what can we do to eliminate malaria, what can we do to mitigate resistance, and what are the current and evolving trends in malaria treatment. As an institution, one of the cardinal functions of an institution is research. The other function is research. The other function is research. That means we keep doing research to the issue of learning, competition and community service are also part of it, but the foundations and the fundamental of an institution is research. So one of the things we can do is to continue to do research in malaria, to bring up new ideas, new findings, which everybody here have been able to postulate and to tell us what are the current trends. But to add to that, I would like to read from excerpt I have with you. One of it is that we must stay informed. We must stay informed. And to be informed is to get the information from the right place, from the right source. And what are the right place and the right source? One of the right place and right source are events like this, the 5th Malaria Colloquium. The reason I'm saying this is that there is going to be 6th Malaria Colloquium. We engage and we encourage all of us to prepare our minds, to prepare ourselves to participate in that 6th Malaria Colloquium. So that by the time we are coming, we should be bringing up statistics of what we have done as people, of what we have been able to be involved when we are taking this program. So we must stay informed, we must stay rigorous, and lead the fight against anti-malaria resistance in your community. You must lead the fight against anti-malaria resistance in your community. And how do you lead the fight? You should not be among those that tell everybody your problem is malaria. Go and treat malaria and typhoid. Don't be a champion, an advocate, a pastor, a preacher of your problem is malaria and typhoid. Because what we are doing is to create malaria resistance and reduce the efficacy of most anti-malaria medications. The right thing I will say, every critical decision you make impacts the global efficacy of these life-saving drugs. Every decision you take impacts the efficacy. That is to say, there is what we call herd immunity. There is what we call herd immunity. And what does that mean? Herd immunity means that if 2-3 persons take the medication and they get the disease, the tendency is that it can cover as many of us. So what does that imply? If you, as an individual, is abusing an anti-malaria, creating resistance, you are invariably affecting other persons that are doing the right thing. Because when the malaria parasite, the Anopheles toxoid, bites you and gets the infection, it transmits it to the
one that is doing the right thing. So we must be an advocate to save the world, to save the global community by participating and becoming before we have these processes, optimization strategies, which have been discussed by our panelists, the data collection, the community engagement, we can become an ambassador to malaria eradication, malaria treatment, and inhibit and stop the resistance of malaria. Thank you very much.
To all our panelists, they did a good job. And I know that we have learned so much this morning. So we're going to give opportunity for us to hear from you also. Questions. We'll give numbers, okay? Number 1 here. Ma'am, sorry. Sir, number 2. Number 3. Number 4. Number 5. 6. 7, 8, 9, 10, and 11. Let's stop at 11. So number 1, please come up. Can we give them mic? Can we give them mic?
Thank you. I'm Professor Jose.
Sorry, please. If you want to ask a question, kindly come forward, come close, so that we don't have to waste so much time. Thank you. Okay. Yes, sir. Go ahead.
All right. My question is to the pharmacologist. I know that malaria vaccine started in the 80s. You said this malaria vaccine trial in the 80s. I monitored it for some time. And the major problem that the World Health Organization was having at that time is that malaria as a disease has several stages. You have several stages. If you look at the malaria cycle, you have the shutdown stage, you have the nasal stage, you have several stages. And there is this difficulty of getting a vaccine that can attack this malaria parasite in all the stages. Sometimes the vaccine will be produced in one stage and then another one will produce. So we will not be able to have one vaccine that can take care of all the life cycle of malaria. So my question is, the one that we have now, which of the stages is it targeted at? Or is it all embracing? Does it take care of all the parasite life cycle stages? That's what I want to know.
Is there anyone that has a question for me? Dr. Riskin, is there any other person that is going to ask a question to me? Any other person? Yes. All right, so okay, let me take just before the question to respond to all of them. Thank you.
All right. Good day, everyone. Standing on the 16th protocol, I would like to ask this question to you, sir. We've been making mention of people taking drugs, taking anti-malaria without prescription. So my question is this. I thought anti-malaria not preventive and curative, in the sense that when I'm moving to a different environment entirely that is prone to diseases like malaria, and can't I just take anti-malaria so that in case I get there, I won't have these symptoms or have this effect? So that's the question to you, sir.
Thank you. Any other person have a question for you?
Good afternoon, everybody. My question, I have 3 questions here. First of all, about the combination therapy, when you talk about drug repurposing, how can the combination be regulated to prevent hepatotoxicity or other adverse drug reactions? Secondly, some antibiotics can alter the absorption or activities of other medications. So, is there a standard regimen for combining these drugs? And finally, how can antimicrobial resistance be mitigated indicated when combining these antibiotics with antimalarial drugs to tackle malaria infection?
Thank you. Next.
Good afternoon, everyone. My name is Ariella Cox. Dr. Christian, I want to say here that in some countries, especially the Western countries, you can't just buy the politics anyhow. It must be prescribed. So don't you think if we make policy that will restrict people from just purchasing malaria drugs, it will go a long way to reduce the drug resistance of malaria.
Thank you very much. Yes.
Thank you very much. My name is Benjamin. Maybe to the theme of the program today, Accelerating Malaria Elimination through Academic Innovation, my theme is this is the very fifth program we have now, and by what Dr. has said, 6 is going to be coming. And I'm looking at the area of collaboration, which is mentioned in it. To what extent are we going to live here? We believe that the team have been put in place. Probably coming together, because there is no way we get innovation running solo. We must be conscious of what we're doing. Set up a team now. Just like he was saying that what will come next year. Let the team tell us this is the extent we've gone. And then the moderator have always emphasized on the issue regarding to our mothers and parents at the home, where they voice some things like this. But now be honest to us, under COVID-19, and Europeans have prophesied that there are going to be dead bodies all over Africa. And unfortunately for them, Africans do not have those dead bodies. Those dead bodies are found in Europe. And Africans were terribly dealing with native at home and all that. And then they get protected. So my thinking is to be very brief. How are we going to set up a collaborative team that next year will be taken this is the extent we've gone to have a local production?
Thank you. You have questions for the answer. For them to respond to this question. Thank you.
Thank you very much. Let me start with the first question from Prof. He asked which stage or stages of the malaria parasite does the vaccine currently in use act on? As I said, I define what the vaccine is, and I agree with it completely that the parasite has a life cycle, what we call the exoelectricity and the electricity phase. The current vaccine in use produces an antibody. The antibody it produces acts on the neoantigen of the parasite, inhibiting the heat shock protein of the parasite. That is, it is more targeting the hepatic phase of the parasite, which is one of the most limiting phase when you talk about the life cycle of the malaria parasite. That is why we have what we call a lapsing fever. If you look at the malaria cycle and the pattern of fever, you will see that when you are infected and you have the disease, you have a period where you can be normal, i.e. low fever. And after some time, you discover that you are having fever. Now, if you understand the cycle, which is not the scope, but then your English, just a small summary, but not in depth, you see that at the hepatic phase, the parasite becomes dormant. It lives in the hepatocyte and lives there for some time. Just the same way it gets to the blood cells, what we call the electricity stage, and it remains there, but it is released in a polycyclic fashion into the bloodstream to bring about its effect. What we call a catcher fever, where you see it is released into the blood cycle and the person the fever goes up, following the amount of parasite that is in the bloodstream. That is why when you are conducting a test, depending on which one you are using, whether it's a rapid diagnostic test or the microscopy, and there are issues to these two, which I'm not going into. This my team is here, they are the authority here in this area, which can build it out. There are advantages and disadvantages of these two methods of testing based on what I have just said, the microscopy and the rapid diagnostic test. So the summary of what I'm saying is that the current vaccine we use is targeted at complete elimination, because all vaccines, what they do, they produce an antibody, as I said, and what this antibody does, antibody starts as a defense mechanism acting in yourself as if you already have the disease. So the moment the disease is about to come into your body, they fight for you. It is a secondary response that is produced, not a primary response. The primary response is usually produced by when you talk about the heat. The primary response is produced by you, but the secondary response is usually produced by your vaccine. I hope, sir, I have been able to give a clearer explanation to that. The second question is in terms of if you can take a preventive drug. Yes, there is what we call IPT. There is what we call IPT. IPT means intermittent preventive therapy. There are drugs. There is difference between doing a preventive treatment and doing a cure. In fact, when you talk about therapy, which is not part of our discussion, but we asked it, when you talk about therapy, there are various classes of drugs used for various forms of malaria treatment. We have what we call the uncomplicated malaria, and we have what we call severe malaria. The class of drug we use for uncomplicated malaria is not the same class of drug we use for severe malaria, for which is not the scope of this discussion. However, there is what we call IPT, which is intermittent preventive therapy. We have to take some drugs for prevention. Those class of drugs are not used for treatment. Example, if you remember, there is what we call the Sunday medicine. Dalaprane, Sunday medicine. The Dalaprane Sunday medicine is an IPT. The sulfadazine paracetamol drug that we give to pregnant women, what we call a fansida, is an IPT. The panodrine that people take is an IPT. IPT means intermittent preventive. But what people do, people go and take ACT for prevention. That is wrong. You can't go and take ACT for prevention, because when you take an ACT, you are taking a drug for treatment and you are creating resistance. So in terms of prevention, yes, there is an prevention drugs that we use. The next question is with respect to the adverse drug reaction attributed to using the proposal. I have said and I stated, the drug proposal, what is done is simple. The pharmacological profile of the drug is already known, i.e., the mechanism of action, the uses, the toxicity, the adverse reaction associated with the drug is already known. So you are using an established data. There is already an established data you are using to change the primary use of the drug to something that is, for example, you know the convention, I will just say the drug, Sedaravine was produced for a different medical condition, but only drug proposal, it is now being used for something else, which I will not discuss the scope, I will not discuss that. Why are you asking that here? What is that? So that is what is used. So those combinations, those drugs I mentioned, the toxicity of those drugs already known before you are combining them. And when we talk about drug reactions, we know the drug reactions have slow accelerators and we have fast accelerators. There are drugs that are known that displaces drugs from the active side. Like I said, we were not discussing that. Drugs that displaces drugs from the active side causing their toxicity to increase. But that drug that increases the metabolism of certain drugs causing their efficacy to reduce. That is known. So after taking those into consideration before you do the proposal, all those effects in terms of toxicity of the drug is already being established. So you are not afraid when those data show that you drug can be combined. The other last, in terms of the policy, I agree with you completely. In fact, we are not talking about those policies only in malaria. We are talking about those policies in all drugs. In Nigeria today, everybody is a doctor. The first point you go to when you have a condition is to go and see your pastor. Your pastor will lay hands on you and deliver you. Your pastor will be the one to tell you who you should do, what you should do, and what you should not do. In fact, as the doctor is telling you what to do, you are telling your pastor, look at what the doctor said, you should I go ahead. If your pastor says don't go ahead, you don't go ahead. So everybody is a doctor. The babies, the farmers, everybody. So I agree with that position 100%. And thank God we have the former commissioner of the executive presented, another members and the executive secretary of the my proposal, as I agree with you, is not only an anti-malaria. If it can be enshrined and legislated in the Nigerian constitution that nobody goes to buy any drug as it's done in the local hospital without the doctor's prescription, it will help to minimize this. very much.
I'm going to add to what you mentioned. Yes, these antibiotics are significant protocol. However, because we're talking about antimicrobial stewardship and we have individual variability, it will also be nice that the right susceptibility test is carried out before testing an individual person because we want to protect our antimicrobial. So as I said, there's a lot of drugs, a whole lot. So to mitigate the issue of resistance, do not self-medicate. Go to the clinic and go for you. Thank you. Having said that, I will still up to 4. Okay, so how many out there? I've just gotten a signal that those questions will be taken later. So just stay on standby, take your numbers, NCC, take your numbers, the questions will come hereafter. Thank you very much and apologies for that. So I will put our hands together for our panelists. They have done so much.
So while we get ready for the second session, she's already ready to run this program on corporate speed. So we want to start with our activities here, and of course with every other stakeholder in the Malaria space. Let's have them on stage while we get ready for the second session. Please your hands together as all heads of department, representations of organizations, professors here, heads of faculties, and other people and panelists will be joining them for the speaker session. Please let's have them now. Let's celebrate them. Hands together, please. The moderators will get a video and be flanked by other reputable panelists here. Alright, let's have the program. Alright, please, we are asked to we set down together. I want to start from I need to take off this. Alright, so please let's go. Please, there are hands together with them, what is it? The hands together with them.
So now let love us with love. So now let love us with love. So I need you to be lying. Affairs are easy as a face. In the front of my head, steady chasing my babe. Sitting myself with the chase. I step side wherever you go. I'm looking for as I start,
please all participants should make sure that their work sickness very soon will start having your lunch. So please sit properly and adjust yourself properly. If your colleague has gone, remember that our certificates are right here now. So all participants here, if you register using that link, your certificates are already ready. So when we are done with this session, we will now, of course, be having your lunch, and of course, you will align yourself according to the serial number and the group from the master list. Your certificates are all ready. Please celebrate your organizing committee now. So, if you have to advocate for us, tell us because something will do something better. Thank you very much. Alright, having said that, we'll be going over to the next session immediately. But please take your seats because the lunch is there. Thank you. Let's celebrate the one that gave birth to me. My mom is at the front somewhere. Now, thank you. Thank you. Oh, thank you. Thank you. If your friends are outside and they're not here, tell them that the certificate will be on site, and if they're not here today, it's in trash. Thank you. Alright. Remember the deputy governor is here. Let's celebrate the deputy governor once again. Represented by a co-convener, Dr. Betty Agala. Your hands together for her. So we have to come through a goodwill message, and while she does that, we also present an award to her. If we interest you to know that the deputy governor, they don't have the volunteers. If we interest you to know that the deputy governor of Rivers State is the Malaria, but she couldn't make it, and she sent someone that is equally very able to represent us. So celebrate the vice governor. So let's have the award presented to her. I think I should do that based on this morning now. So let's celebrate the deputy governor she makes her way. Your hands together now. So she will do the goodwill message, then of course we'll go to the final session. Thank you. One of the class, please. Your hands together. Let's go to rise. That's the deputy governor. Let's go to rise, please. Thank you very much. This is an award of excellence presented by the EKPRIKPO Health Foundation to Your Excellency, Professor Ngozi Mahojo. The Deputy Governor of Rivers State, in recognition of your dedication to advancing malaria control, strengthening our health systems, and inspiring bold action towards a malaria-free Rivers State. We proudly honor you with this award of excellence as the malaria champion of Rivers State. On this day, 26th, it's supposed to be 24th of April 2026 at the chambers, achieved by Senators of Wicked Senate Building Chambers. Congratulations. Your hands together.
Number one, nothing less. Lead me to my destiny. I have waited patiently. I have vision, though I believe. I know I can count on me. So stand up for the champions, for the champions. Stand up, stand up.
Alright, thank you for her good message. Thank you. The
afternoon, everyone. The head table has gone down to the front table, but permits me to recognize the Vice Chancellor, the Digital Vice Chancellor of the River State University, here ably represented by my dear friend and colleague, Dr. Professor Fortune Amataria. The keynote speaker for today, a Colossus herself, because she's my classmate and the class of 2001, University of Port Harcourt is the Colossus. Can we give her a round of applause? She did a colossal presentation. Other members of the head table that were here before we sat down to see the panel. Stakeholders here present. The Provost of the River State College of Medical Sciences, who was here earlier, my own friend, distinguished ladies and gentlemen of the press, ladies and gentlemen, if I have missed any other group, permit me to adopt the existing protocol. Let me start by saying a big thank you to Her Excellency, the Deputy Governor of River State, Professor Mrs. Ngozi Maodu, distinguished Fellow of River State, for giving me this unique opportunity to represent her at this very auspicious occasion, where incidentally I recall excellency for having this level of trust in my capacity. And so, without much ado, I will take the speech by Her Excellency, Professor Ngozi Maodu, DSS RIVCHPP, at the 5th Malaria Colloquium. I'm deeply honored to be part of this important occasion, the 5th Malaria Annual Health Colloquium, organized by the ERENS Health Foundation in collaboration with the River State University and, of course, the River State Contributory Health Protection Program. Today, as we commemorate World Malaria Day, we are reminded that malaria remains a major public health challenge, particularly in our region. However, gatherings like this reaffirm our collective resolve to confront this challenge. Through innovation, research, and strategic partnerships. The theme, Accelerating Malaria Elimination through Academic Innovation, River State University leads the way, is both timely and inspiring. It underscores the critical role of academia in developing sustainable solutions and shaping policies that will ultimately eliminate malaria. You recall the panel session that we just had, and one of the questions is, what are we going to do after this meeting? Where are we gathering? What is the plan on ground? Because we want to hear from the academia, we want to hear from the university. As a government, we support initiatives that promote public health, strengthen healthcare systems, and improve the well-being of our people. As you can see, this administration has put in place a number of the strategies that are required to ensure that we have a healthy river state. Ditto the RIVCHPP, the ongoing infrastructural development in the health sector, the employment of healthcare providers, and of course, other engagements as exemplified by the Deputy Governor being here as a malaria champion in this meeting. I commend the organizers for their dedication and vision in driving this impactful initiative. Let me also use this opportunity to call on all stakeholders, government agencies, development partners, tertiary institutions, the private sector, and our communities to intensify efforts towards malaria prevention, early diagnosis, and effective treatment. Together, we can achieve a malaria-free river state and a healthier, more productive society. Thank you very much for your attention, and God bless us all. signed by Professor Mrs. Ngozi Maodo, DSSRS, Deputy Governor, Rivers State. Thank you. Okay, let's give another round of applause. Thank you very much, ma'am. Again, let's put our hands together for an insightful first panel session. Put our hands together for our please. That session provided us with diverse perspectives, and if you are taking anything, if you don't remember to take anything home, just know that not every symptom is malaria. So tell your friends to get tested so we can have the relevant data to move forward. Building on this momentum now, we will be going into the second session where the conversation will take a step further. At this point, I'd like to invite our panelists for this session. We have, to moderate the second panel session, let's put our hands together for Dr. EKPRIKPO. Round of applause, please. We will be having shortly the presentation of the certificate. So we also have for the second panel session, Mr. Bruce Lucas. Let's put our hands together for Mr. Bruce Lucas. Let's put our hands together so we can say please. Mr. Bruce Lucas. Let's not get tired. We also will be having on this panel Professor Peter Ayodeji Ekunwe. Round of applause, please. And we have also, let's welcome to the stage Professor Z.A. Jeremiah. Thank you very much, sir. And lastly, we have, as part of the second panel, Professor Evelyn Eze. Before we continue, we'll have to do a presentation of the certificate. I'm just going to start from Mr. Bruce Lucas. Please, let's just listen to this for his citation. Mr. Bruce Lucas.
An abridged citation of Mr. Bruce Lucas. Bruce Lucas is a renowned entrepreneur and technology executive from Bayelsa State in Nigeria's Niger Delta region. He is the founder and CEO of Olotu Square, a technology innovation hub focused on youth capacity building in business and innovative technologies. Lucas is also the CTO of Gerald Care, a key stakeholder in Port Harcourt's tech ecosystem. Olotu Square, founded by Lucas in 2016, has become a hub for startups, tech enthusiasts, and entrepreneurs in the Niger Delta region. The organization provides business support, mentorship, incubation, and networking opportunities to young entrepreneurs. Lucas's vision for Olotu Square is to create a community of champions driving innovation and growth in the region. His passion for technology and innovation has earned him recognition as a key player in Nigeria's tech ecosystem. Through Olotu Square, Lucas is empowering young Nigerians with tech skills and entrepreneurship training. The organization has hosted several events, including Women Tech Makers and Cybersecurity Boot Camps, and has partnered with Google to promote digital skills development in the region. Ladies and gentlemen, please welcome our esteemed panelists at the 5th Malaria Annual Health Colloquium, Mr. Bruce Lucas, to discuss the topic, leveraging innovation and technology for malaria elimination.
Thank you. Please can we have on stage Dr. Done Lida, Vice Chairman Association of Medical Laboratory Sciences, River State University Teaching Hospital Chapter, to present the award to Mr. Bruce Lucas. Round of applause, please.
And as a panelist, we are glad to present to you Mr. Bruce Lucas, at her 5th Annual Health Colloquium. We are proud to present to you this certificate of appreciation.
Thank you very much, Dr. Lida. Thank you very much for starting this. We would like to welcome again Professor Peter Ayodeji Ekunwe.
An abridged citation of Professor Peter Ayodeji Ekunwe. Professor Peter Ayodeji Ekunwe is a distinguished professor of agricultural economics in the Department of Agricultural Economics and Agribusiness Management in the prestigious Faculty of Agriculture, University of Port Harcourt, and a leading authority in farm management, production economics, and agribusiness development. He holds a PhD, MSc, and B.Agric in Agricultural Economics from the University of Benin and has over 2 decades of academic research and administrative experience across Nigerian and international universities. Professor Ekunwe's academic career reflects steady progression, intellectual depth, and sustained commitment to excellence in teaching, research, and service, growing from an assistant lecturer to strengthening smallholder agriculture and promote food security in Nigeria and sub-Saharan Africa. Beyond national boundaries, Professor Ekunwe has served as a visiting professor, research fellow, and sustainability in Thailand, and is a long-standing external examiner to several universities. He also provides editorial leadership for universities. He also provides editorial leadership to reputable academic journals. He is a recipient of the TWAS Elsevier Grant for Sustainability and Rule Forum Grants as well. Through scholarship, mentorship, and service, Professor Peter Ekunwe exemplifies the ideals of academic excellence and societal relevance. His work continues to shape agricultural economics, thought, practice, and policy. Ladies and gentlemen, please welcome Professor Peter Ayodeji Ekunwe, our esteemed panelist for the 5th Malaria Annual Health Colloquium, speaking on mobilizing resources for malaria research and innovation.
affiliate should have the Chairman, AFM LSN, RSU chapter to present a certificate to Professor Ikonkwe.
Okay, this award is presented to you, Professor Peter Ayodeji Ekonkwe, at our 5th Annual Health Colloquium on this day, 24th of April 2026. Thank you very much. Congratulations.
Nothing less. Lead me to my destiny. I have waited patiently. I have vision, though I believe. I know I can count on me. So stand up for the champions, for the champions. Stand up, stand up, stand up.
Dr. Soma, welcome, Professor Ikonkwe. Now we would like to welcome another of our esteemed panelists, Professor Z.A. Jeremiah. Round of applause, please.
Brief citation of Professor Zacchaeus Award to Jeremiah. Professor Zacchaeus Award to Jeremiah is a professor of laboratory hematology and blood transfusion science in Rivers State University, Port Harcourt. He holds the Doctor of Philosophy in Hematology and BTS, Fellow of the Institute of Biomedical Science, London, Fellow of the Royal College of Pathologists, London, and Fellow of the West African Postgraduate College of Medical Laboratory Science. He is currently the Regional Chair of the Hematology Faculty in WAPC-MLS. He has served as an international mentor in the UNDP and RC Partner Skilled African Program in the East African countries of Kenya, Tanzania, Zimbabwe, and Uganda. He has supervised and graduated over 15 PhD students in Nigeria. He has over 100 research publications in national and international peer-reviewed journals to his credit. He is the founding president of the Hematology and Blood Transfusion Sciences Society of Nigeria, and he is happily married to Dr. Mrs. Teresa Awotu Jeremiah, the National Vice President, Association of Female Medical Laboratory Sciences of Nigeria, and they are blessed with 4 children. Ladies and gentlemen, please welcome our esteemed panelist, Professor Zacchaeus Awotu Jeremiah, to the 5th Malaria Annual Health Colloquium. He will be discussing the topic, Understanding the Consequences of Malaria's Impact on Hematological Parameters.
Scientist World Precious YLSF Chairman of Rivers State to present a certificate to Professor Jeremiah.
Thank you very much. Good afternoon, sir. Well, I was privileged to be just like this. I dream of that graduate. It's also a privilege to present this award. So, an award presented to Professor Zacchaeus Jeremiah at the 5th Annual Health Colloquium. Themed Accelerating Malaria Elimination through Academic Innovation at the Rivers State University. Once again, congratulations.
We'd like to give a warm welcome to another of our esteemed panelists, Professor Evelyn Eze. A round of applause.
An abridged citation of Professor Evelyn Umbeoma Eze, PhD, MSc, BMLS, AML, SCN, MIPAN. Professor Evelyn Umbeoma Eze born in Aji, Enugu Ezike, in Ibo Eze North Local Government Area of Enugu State on 24th September 1970. She attended Urban Primary School Unsuka, where she obtained her first school living certificate in 1982. She also attended Community Girls Secondary School, Isienu, Unsuka, and obtained her senior secondary certificate in 1988. She obtained her Bachelor of Medical Laboratory Science, BMLS, in 1996 from the prestigious University of Nigeria, Nsukka. She later obtained a master's degree in hematology in 2007 and a PhD in hematology/blood group serology in 2009 from River State University of Science and Technology, now River State University. Her work experience includes Madonna University, Elele, 2009 to 2012, and River State University, 2015 till date. She was also a visiting scholar in Pamo University of Medical Sciences from 2021 to 2023. She is currently a professor of hematology and blood transfusion science and the pioneer head of the Department of Hematology and Blood Transfusion Science, Faculty of Medical Laboratory Science, River State University, Port Harcourt. She has published over 130 articles in both international and local referred journals. She has attended many conferences, trainings, and workshops. She is also an associate editor, African Journal of Laboratory Hematology and Transfusion Science, and has been a reviewer for many journals, including International Journal of Research and Reports in Hematology in April 2023, and African Journal of Laboratory Hematology and Transfusion Science in February 2024. She has supervised 32 undergraduate and 2 PGD projects, 27 MSc dissertations, and 20 PhD theses. She has been an external examiner and assessor to many universities, including Niger Delta University, Federal University Otueke, and Bayelsa Medical University. She has also been a representative of Medical Laboratory Science Council of Nigeria, a registrar/CEO in the conduct of professional examinations in other universities. She is a member of many professional bodies and associations, including Medical Laboratory Science Council of Nigeria, Association of Medical Laboratory Scientists of Nigeria, West African Society of Toxicology, Hematology and Blood Transfusion Science Society of Nigeria, Association of Female Laboratory Scientists of Nigeria, Nigerian Biological Safety Association, Nigerian Environmental Society, and Institute of Public Analysis of Nigeria. She is happily married to Professor Chibuogo L. Eze, and her marriage is blessed with children. Ladies and gentlemen, please welcome Professor Evelyn Mbeloma Eze, our esteemed panelist for the 5th Malaria Annual Health Colloquium, speaking on ensuring safe blood transfusion practices in malaria endemic areas.
Request for pharmacist Promise Amele, former PSN River State board member RIVCHPP, to present the award to Professor Evelyn Eze. Pharmacist Martha to present the award, please. Thank you. Of appreciation as a panelist presented to Professor Evelyn Eze at Our 5th annual health colloquium with the theme Accelerating Malaria Elimination through Academic Innovation. Rivers State University leads the way. This day, dated 24th April 2026, at Chief Barrister Nyesom Wike Senate Building Hall, Rivers State University. Congratulations, Prof. To the moderator of this second panel session, Dr. EKPRIKPO. I'd like to call on Dr. Isoma Shiladi Jeff, Assistant Secretary, Association of Medical Laboratory Sciences National, to present the award to Dr. EKPRIKPO. Round of applause to the guests on stage, please.
Make you come to me in my bed. When you go pick up, baby, this Friday. Me and you are the chilling in my home. We got to listen to some songs about this Friday. Baby, we could live.
First of all, happy birthday. Certificate of Administration as a moderator presented to Dr. EKPRIKPO and her 5th annual health curriculum. Theme: Accelerating Malaria Elimination through Academic Innovation. Rivers State University leads the way. On 24th April 2026, as Chief Barrister Nyesom Wike, Senate Building Hall, Rivers State University.
With such an impressive lineup of expertise and experience, we can expect that this will be a truly enriching experience. So let's listen, let's learn, and let's actively engage as we take steps to eliminate malaria. Thank you.
Thank you. The best governor will be presented by Dr. Digital Vice Chancellor, will be represented by Colloquium, by Dr. Colloquium Taria. I also want to acknowledge and distinguish the lecturer for today, Dr. Professor Ilamo, and also every one of you permitting me at this point to seek honesty and well-established protocol. Can I say I'm excited? I'm looking out for Dr. ERENS. I wanted to actually report it to the Digital Vice Chancellor, but I think she stepped out. Why you should put me here, keep me here, himself and the little tiny mosquito to celebrate my birthday here. But it's a great privilege. And I'm excited having with me very distinguished scholars and to see how we can have a discussion around innovation technologies that could help actually eliminate this malaria we're all been talking about for ages. We also look at resources and how to get resources for researchers. We also look at the impact malaria has had also look at transfusion. We listen to this that are promising. We're going to be considering or looking at when we talk about malaria elimination.
Thank you. I think the fundamental thing we should first take our minds back to the fact that technology is just a tool that makes things easier, right? So at every point in time, we talk about innovation in tandem with technology. We're talking about that different way or that different approach or that new approach that you took to make technology easier or to make that process easier. And so it's a problem to see that locally not a lot is done around the eradication. Management, yes, but there are vaccines, which I've heard some other fellows talk about. There are vaccines now that technologies are produced that can help with malaria eradication. But I'm still worried in context of a colloquium like this that we've had like 5 times. I'm still worried that as Nigerians we don't take 2 very important things seriously. One is food and the other is health. For every state, look at their food budget, look at their health budget, it's not that serious. Even nationally at the federal level, health budget and food budget is not taken in comparison. And so, if we can't do anything about food in this room, I know we can still do something about malaria, because that is the interest level that's bringing us together. And so, technologies that have to do with malaria eradication has to be driven by people in this room. But really now, there's no clear-cut move to eradication, or there's no clear-cut path to eradication of malaria. Management, yes. Reduction, yes. They're not clearly eradicating malaria. Just like we had in the case of polio. In 2020, it was announced that polio has been eradicated from Nigeria because they have recorded 3 years of no polio case at all. That was a deliberate action that even the Rotary got involved in, sponsoring several polio campaigns and so on. But in this curriculum, in this place, it would be beautiful to see that people in this room, people in this panel, this university can actually drive the eradication in the context of driving eradication, not just management. Thank you.
Thank you very much. So all ambassadors to drive the process of eliminating malaria. Okay, looking forward to that anyway. So, but we know that this technology and all that we're talking about is not cheap. You know, it's not cheap. I know how much some of us actually spend on buying data, whatever network it is. I'm sure that is where most of us want to go to these days now. Our work is in data, and everybody is online every now and then, reading and all that. And we listen to resource persons talk so much about research data, and all that. So I'd like to talk to Prof. Professor Peter. So how do we get grants or see how we can promote research to writing maybe grants or getting resources somewhere, so we can all be these ambassadors through our research, through our school, to ensure that we, if not eliminate malaria, but at least reduce the volume of malaria.
Thank you very much for that. It's very important to understand grants. It's like a funding for your research work. Now the issue here is, there are people or there are institutions that are willing to throw their money into research in Africa, around the world. Now, of course, we have several types of grants. We have grants, for capacity building. We also have grants for research work. We have grants that we help for scholarship for PhD and MSc research. The most interesting thing is the fact that these grants are given by several bodies, like WHO. We also have the global funds provide grants. Even the Bill and the Gates also provide funding for malaria-specific research. TED Fund also is able to give grants as well, which is our local institution here in terms of funding of research in our university campus. The major problem is not about the idea you have. The idea might be good, but the idea is not implementable. You are not able to implement the idea does not have basis. And that's because when I look at your grant proposal, sometimes it is vague. Most of the grant proposals are vague. There is no direction. So funders are looking for a particular proposal that will state a particular problem. For example, in malaria, you can be talking about just like the vector issue, or you are looking at specific. I want to deal, my project is going to be specifically with women and children. Now, the grants awarding will tell you this is what they want. Now, if you are able to identify a problem, the next is that the funders want to know if that problem is solvable, if you are able to solve the problem. And if I'm giving you my money, for example, I'm a funder, I'm giving you money to go and do a work, I should know if you are able to solve a particular problem and if the problem is going to address real world situation. Because we have come to see that a lot of people try to get grants and they use it for other purposes. Now, when you are writing a proposal to get grants, you must understand that there are certain basic things. We don't write, our advice that don't write like a researcher. My madam used to tell me that you write like a social scientist. You tell the story. Because they are not interested in all the statistics you are looking for. All they want to know is that what is the problem. So, that's where collaboration comes in. If you are in the sciences, you'll find out somebody in social science. Know the social sciences, they like the stories. And funny enough, they are the ones that can give a story of the socio-economic background of a particular situation that goes on in the community that has to do with malaria. So, understanding these basics, you'll be able to do that. Then, one reason your proposal can fly is if you have a budget that is realistic. If your budget is not realistic and is not implementable, you cannot get a grant. Then also, if my time is up, just then also you must understand that there are times you have to collaborate with the community. You are going to do research, you are using a particular community, and you don't know anything about the community. You've never had a community engagement with the people in the area. And you're writing a proposal concerning those people. There is no way you can be able to get a good or sound proposal. So you must engage the community within the area you are going to carry out your research. In so doing, you put facts together. And once these facts are there, you present your proposal. And I can guarantee you, because this is what the funders are looking for, you are following their guidelines specifically, you'll be able to achieve that.
Thank you very much. I'm sure that a lot of us in this world really interested in this particular issue. It's accessible, and individuals can actually apply and get grants. Is that what you're saying?
Yes, individuals can access them, but I always like collaboration.
Okay.
Collaboration as a way, funders, they try to look at who are you collaborating with. Are you collaborating with governments, with institutions, or you are just standing alone? Alone grant writing usually might not be successful. But except you are writing, maybe you are representing an NGO and you are fronting the NGO, then you can be able to achieve a lot.
Thank you very much. Yes, because this has always been one limitation, funds for research. People are actually interested in doing this research a lot, but they will always tell you funds. So when you're a specialist in this area, so you just keep tapping and tapping, Salman. So, Professor, I want to come to you. We're talking about, I listened when you were asking that question, I was thinking, you know, when we were talking about the scene, and we were asking which area of stages, where there are different stages and all that. So, and you are a professor in this area. I mean, what are those changes that actually occur when we have this infection from this spiny mosquito, like you said? Changes.
Thank you. Thank you so much. First of all, let me announce to this hall that your blood is your life. The Bible says the life of a man is in the blood. It also says that the blood is the life. And so anything that borders with your blood is also bordering your life. So let me start by saying that malaria is a disease. As we have been saying here, it's caused by one, unfortunately, it's a woman mosquito. So I think all the women in this house should put hands together to see how to meet with the women malaria partners and say, well, how do we solve this problem? So malaria triggers a whole lot to the body, hematological problems. The very first that happens is called anemia. That anemia is simply the shortage of blood in a simple term, or the poverty of blood. How does it happen? It happens this way. When malaria gets to a stage where we call the Shizon stage, at the point they will burst out of the red cell. When malaria bursts out of the red cell, it now destroys that red cell. So each of that episodes destroys the red cells, and the red cells will now, you know, if it is 100 that is there, it will now be reducing in number. And if it gets to a point where the number is too low to support oxygen delivery, because the primary function of the red cell is to carry oxygen. They carry oxygen to the brain, to every part of your system. So if it gets too low and cannot do this function, then your life is at risk. Then another way that it happens is that once the red cells are infected with malaria, they become susceptible. There are other cells that they will see it and remove it away from the circulation, because when God created red cells to circulate in the human circulation, He created it very clean. The red cell that is supposed to be running in your brain is not supposed to carry anything. So that is why when a red cell is carrying malaria and is passing through the spleen will remove it. It's just like the checkpoint in the body. They stop the red cell and say, what are you carrying? I'm carrying malaria. Drop it. And as they drop it and incubate, the spleen will get enlarged and become what we call splenomegaly. So those red cells will remove. That is another one. Another thing that happens to it is what we call oxidative stress. The red cell becomes stressed oxidatively, and then they begin to exhaust and die off. So the bottom line is anemia, that is to the red cell. There are also other components of the blood which we also have. Like we have the platelets, which also help us when we have injury on our bodies. So the malaria will also help to remove it. Because by the time they pass through the spleen will remove it, and some platelets will pull along. And then at the end of the day, we have a condition that is known as thrombocytopenia. It also leads to leukopenia, which is the reduction of white blood cells that fight diseases in the body. When we have malaria, it brings down that number. If you do your WBC count, it will be low at a certain point. You know, because malaria will also pull it along. Then Sometimes if it goes with bacterial infection, it goes up. You now have what we call leukocytosis. So generally, the impact of malaria is on all the components of the cell that we carry in the body. And the bottom line is to reduce your lifespan. Thank you.
Thank you very much. We call it tiny mosquito. It's doing quite a bold work. And with all that Prof has told us, it means that there are implications to transmission through transfusion. So, Prof, can you please share with us, is there impacts for transmission of malaria through blood transfusion? Because most of us, there's hardly any day, anytime that we don't have people having blood transfusion. Most times they talk of HIV and all that. The shift is not towards malaria being transmitted through transmission.
Okay, thank you so much for that question. Of course, when we talk about malaria transmission, to many people, you look at the mosquito-borne transmission, the one that's environmental. But you go beyond that, we see that blood transfusion is one of a major effect of malaria transmission. And this is so important when you look at the vulnerable groups. Vulnerable groups are the under 5 years, pregnant women, and the immunocompromised individuals. Like those that have HIV, AIDS, and then other issues. In our society, and generally in sub-Saharan Africa, we know that malaria is endemic. And because it's endemic, it's a big problem. Because you see that many people in the society, including the blood donors, they harbor malaria parasites. And research has even shown that blood donors they have high prevalence of malaria parasites. Some studies, like one we did in 2021, the one of the teaching hospitals in River State, we got 23% among blood donors. But there are even other studies done in other parts of Nigeria that was much higher than that. There was a study in the northern states that had up to 55%. And the norm in our climate, because of our limited resources, we don't screen everybody that comes in to donate to zone. Ideally, eligible donors should be screened for malaria. But because of our setting, we don't have the wherewithal in terms of finance to be able to incorporate all of that. And because of that, you see that we don't screen. That's the major thing that is being done. We don't screen to give anti-malaria residents. But giving anti-malaria to residents will not solve all the problems that is inherent in this in transmission through blood. Because if we are looking at blood transmission, malaria being transmitted is more dangerous than the one that is being transmitted by mosquitoes. Because the transmission is direct to the patient. You're giving a whole lot of malaria parasites. It's like injecting in their number into the person's bloodstream. And it will be faster. It's more severe than the other one.
Thank you, Prof. I'm still processing what you have just said. It's fast going. we are taking functions like this so that we can actually go back and carry out action plan, see how we can be part of policies, see how we can bring to bear what we are actually going to learn. And I think that from what she has said, it is really deep. There's no reason why we should have got screening for malaria before transmission. Thank you so much, Prof. So I will go to our technology man. He's so scary. And then right now we are, I don't know, is it Gen Z now, Gen Z A1? Which generation are we now? This generation where we are now is AI technology. Everybody is living in the cloud, selling their, and all that. He said, AI and all of that can do for us when it comes to eliminating malaria. We read about predictive modeling, and things like that. Can you maybe help us?
Yes, that exists. That exists, and AI has a lot of role to play in this. But there's also a fundamental problem in that. Look at this. If I go to school and I study computer science, and I come out as a computer science graduate, and I can build software, that's fine. I can build software, but who am I building software for? Because computing and computing technologies is for every sector. So if I have to build a software for business, I need a businessman. If I have to build a software or build a solution or build an AI bot for health, I need a health professional. If I have to build something for civil engineering, I need a civil engineering expert. In order to build something that solves the problem, right? So people that study computer science are actually troubled with the fact that they have to learn a new thing in order to build something to solve that problem. But look at it this way. Somebody that studied computer science can't build a professional AI model that solves a health problem because he does not know what health is about. He does not know the nitty-gritties about malaria and some of the names I've been hearing there. So if I call myself an expert in tech, and I'm going to build an AI model that will just solve this problem, spatial analysis, geospatial analysis, surveillance, any kind of thing towards malaria replication, I still need to have in-depth knowledge about health. I need to understand how these organisms work. I need to understand how the transmission works. I need to understand a lot about health. That is why it's most important for people in health to get involved in technology as well. Because people in health are the ones who use the best technology to get that result. If you have doctors that understand technology, they are the best persons to put together the materials, put together the research, put together what is needed to get that goal. Explaining it to me as a tech expert, my day is 6 more years to understand and feel close to what you want to see. Right? So it might be a call for everyone in the room to understand that being in the medical field is not exhaustive if you want to solve a problem with technology. You need to pick up a tech skill that helps you become different, stand out, and solve the problem within the space of the medical field using technology.
Most of them are not health professionals, and then we feel that some of those jobs are for some certain people. We also have people that are into selling reagents and calibration of machines and equipment and a whole lot. Now, technology has come. We're not looking at it as though we have to be part of it. We're so limited. We limit ourselves from our mind, and today you're baptized, you're released to go and explore in Jesus' name. And is that what you're saying? So there's so much for us. We're the best people as self-professionals that can exploit that area. We trying to understand how to, all the navigations he has to make to create that model that will help to eliminate malaria, this same small tiny malaria we're talking about. So please, let's have an open mind and we need to see how we can exploit from this area. That's the essence of coming out for events like this. Thank you very much. I'll come to you, Dr. Peter, please. This research team is very key, it's very important, and it's not nice that we live here without actually having a grasp. After now, we'll just see how people respond by asking questions so that we'll talk about their challenges and so on. But we want you to help us with what are some of those pitfalls that you can just look, because you're an expert in this area, that just when you see it from the beginning, you just know that this is a no-no. What are those pitfalls?
Well, there are some very common, let me just give you background. Some projects will just stop. Immediately funding stop. This is a major issue we have with, assuming you've gotten the research grant, right? Now you are doing a project, immediately that funding stop. A lot of people, that's the end of the project. But there is a part of, scaling up. There's a part of moving beyond, assuming you did a malaria project, in a particular community. And after that, you just go, that's the end. You just pack your bag and go and go sit at home. What about moving beyond that community to several communities? Now this is very important because immediately we neglect that aspect of sustaining a particular project by bringing in partners. Like I said before, you cannot successfully, continue to carry out the project alone. You must bring in partnership from government, from philanthropic organizations, from other NGOs, collaborating. Go with Rotary. Rotary is here, right? You can partner with us, right? Rotary is involved because it gets funding from USAID to be able to carry out a lot of issues with malaria prevention and all the rest. You can form partnership with Rotary and they will collaborate with you. But if you neglect all this, it becomes very difficult. That's for the growth, for the sustainability aspects, because a very good project is the one that is able to sustain itself. And in sustaining that project, we are assuming you've gotten the grant already. You've done the work. Now the next year, what are you doing? You just don't sit down and package what you call it, your research tools and say, done. No, you scale up. You think of how you improve other communities. That's the impact we're looking at. So we have that impact. I'm not talking about the proposal writing now, which I believe once we have mentioned the pitfalls of proposal writing, but we are talking about blended finance, or just about blended finance. Then we bring out blended funding, co-funding, for example. What are you bringing to the table? That's what we normally ask. When they want to get married, what is the woman bringing to the table? What is the man? Co-funders means that the person funding will also know what you are bringing to the table. So that we will see, it might not be in finance, it might be in what do you call it, labor, it could be in personnel, it could be in volunteer and all the rest. So these are some of the things. If you don't understand them, your project after 1 year, that's the end. Thank you very much.
Thank you so much.
Okay, so just thank you for that. And I just want to chip into something. If you open your phone now and go to Google and search funding opportunities for malaria research, I just did that. There are lots of opportunities, and in thousands of dollars. There are lots of them. So it can actually be done. But sometimes when we gather in rooms like this, we do more of the talking than the action, right? And there are some people that are students here, they are waiting for opportunities to jump in with that research. There are some lecturers that are looking for opportunities to jump into huge research as well. But they are waiting for who will bring the opportunity down. So the lecturers have got the opportunity to this gathering, and everybody is here discussing the issue of malaria. Now, people in this hall, some people in this hall are waiting for who will bring the opportunity of a research grant for them to jump into that research. Because it's right there. Now, if you go individually to make applications for some of these grants, you may not get them. Right? But the school at an institutional level can approach some of these grants with the Gates Foundation, present that proposal that an individual will not present. Present that proposal and offer it to the students, to the lecturers, to the professors to do that research and take one step ahead. So it's important also that as we discuss the ideas around it, the strategies around it, we should also talk about what action plan can be taken by at an institutional level to see that research grant in millions of dollars comes to this school or comes to this foundation and is put into an actual research that we can announce in the next year's colloquium. Thank you.
Thank you very much.
One of the very big research grants that can be obtained is from the global funds. The global funds deals with both tuberculosis, HIV, and malaria. Now, you cannot get it alone. You have to work with organizations, for example, like the Rotary. You can work with Rotary Club. You can work with the government, Ministry of Health. Then, as an institution, the three components will come together and present a proposal. By so doing, it stands a lot of chances to win a grant, rather than standing as an individual. Thank you very much.
So much for this idea. Thank you so much. So, Prof, we will come to you. You told us so much about the impacts and all that. What are the strategies that you think that we can actually employ with what you are saying, your understanding of what you are saying? You know, because there are some things we can control. There are some we will not be able to control, but we can, actually through policies. Because I remember some of the things that we can control, our behavior. Our resource person talked about vector control, where we actually breed these vectors around us intentionally. I keep asking, I don't know where the culture came from, that when the rain falls, we will now bring out our beans from the dustbin from our homes and pour them on the rain, on the floor, nature roads. So the rain slides with them, and then use them to block the drainages. And of course, here we have one drainage outlet, say Tawa Bridge, everywhere it comes, and then you have these tiny mosquitoes breeding and all that. Those things we can actually control, just by changing our attitude and behavior. But the Prof has talked about those changes that occur inside of us. And understanding of these things can actually take us somewhere in developing strategies to be able to help patients care. Please help us go on that.
Correct. Like I mentioned, I talked about the impact, how malaria is impacting on the human life. And a lot of people have mentioned a lot of things that we can do as an individual. When you suspect that you have malaria, what do you do? Well, that has been mentioned in the last session, that you don't just go to the chemist and buy a drug and take. You have the laboratory there. This is an aspect that nobody can tell you except you go to the medical laboratory and then you are being diagnosed. You must be diagnosed that you have the malaria. And so that is the starting point. The diagnosis of this disease is the starting point. Whenever we misdiagnose it, it becomes a problem. So as an individual, when you have anything that you suspect, because malaria behaves the same way mosquito behaves in daytime. In daytime like this, you will not see malaria. They will hide somewhere. In the night, they come out. The same thing in the body. The parasite hides in the liver. And then at certain times, they come into the circulation. That is when you feel the fever. And if you want to really see the malaria parasite, that is when you should have your blood collected. That time you are having feverish condition. It means that the malaria is circulating in your body at that time. If you don't collect your sample that time, and you leave it until the fever subsides, you must have gone back to the liver to go and hide. So, how you get yourself diagnosed is the most important thing. And then after the diagnosis, what next? If I want to tell us, everybody sitting down here, if we collect our samples, we have one malaria parasite on board. Everybody carries it, but God has wired your body to fight these things. That is why you are not coming down. But whenever you come down and it's malaria, then treatment and other things will now come. But for the way forward, there are many things we can do in the diagnostic aspect. You know, like we are trying to expand now. These days you have RIVCHPP, you have so many things, and then we also talk about malaria resistance, which only the molecular diagnosis can help us to know whether there is malaria resistance or not. So we need that molecular aspect of diagnosis to be domiciled in our health system and in our institution, like here in the university. We should be teaching the students with these things to see how it is. You know, they need to see them and see how it breaks. Then we will also have we're talking about the way forward now, the eliminating malaria. I was looking about genetic modified mosquitoes. Genetic modified mosquitoes cannot work here. Cannot work here because they work in preventing, not where the malaria is already, the disease is already distributed. So, in our own peculiar situation, what do? We need to go back to the environmental situation. We need to clean the environment. But whenever we have any need that we are infected, please go to the hospital, get yourself diagnosed. And the first thing, everybody that goes in the hospital, the first thing you pass through is to check your hemoglobin level. Your hemoglobin level will tell you whether you are anemic or not. If you are anemic and you have malaria, then there is a tendency that if you don't treat it, the malaria will continue to eat your blood until you get to the point where you will even need transfusion. So we need to know how to take care of ourselves. We also need, as an institution, to know what to do forward. We need digital microscopy because that's the problem we have. To see the malaria parasite, manual microscopy, not everybody is skilled. It. And so most times people don't really see these malaria parasites and they report it. But if we have the digital microscopy, it gives a bunch of precision to the diagnosis. There is also an element of artificial intelligence in malaria diagnosis, which we have not explored. We need to explore machine learning and all that to give an accurate diagnosis of malaria in our so that we know that what we are doing is actually malaria. Because many times if you carry out research, you see the percentage, the prevalence of malaria you have, it's less than what is reported. And you ask yourself what is the problem. So I think I don't know whether I've given insight into your question. Thank you.
Thank you so much. So finally, very quickly, let's ask our prof, because I think you've talked so much about transfusion and response scaling. Like I said, I'm still processing it. So, what do you advise? How do you go about implementing to ensuring that maybe at least we can spray the blood for malaria, at least crucial. Most times they only do for, like I said, HIV and a couple of that, but this one. And what advice would you give so that as we are all representing different organizations and facilities here, we can actually start going back to work on it? Action, like what's going and listening and doing it. So please get your questions ready while our prof takes that bit. Thank you.
Thank you. There are several ways we can go around. Of course, generally speaking, in this sector. There are things we should do. And the WHO has also recommended to us that we should screen where appropriate and possible. Screen where it is appropriate and possible. For us, we can do that. Reason being that if we begin to screen every donor for malaria parasite, we will have shortage of blood transfusion generally. But we know that there are some groups that we can't make mistakes to give malaria positive blood for transfusion. Like I have mentioned those groups, the vulnerable groups. So, what it means is that, like Professor Mann said, measure the protocols and use in screening. We also include proper donor selection and referral. Make sure you ask pertinent clinical questions to make sure that those that are coming from so that malaria and all of that are included. And then you are also supposed to do targeted screening. So make sure you recommend that for us. If you know that you want to transfuse blood to an under 5-year-old child or a pregnant woman, make sure you screen that blood for malaria parasite. Prophylaxis, what they call presumptive prophylaxis, you can just give the living that malaria parasite you give. But in this particular group, that will not suffice. Because somebody is already anemic, like a pregnant woman that is having malaria, probably the hemoglobin level is already below 7 grams per PM. And then you now transfuse blood that has malaria parasite to that person. Obviously, when such transfusion is done, the ones you transfuse, and even the ones that were normal, will be destroyed alongside. And malaria will even increase. The person will be more at risk. And the person will probably need more transfusion because it's more at risk based on what you've already done. So it's like, you want to help somebody, but you're participating in this. So for them, we must do targeting. We must do their samples. We must. That's one aspect. Then of course, even as we know that microscopy, using microscopy, we say is a standard method of screening. You know, it's a gold standard. But we know we have limitations. And the activities we use also in random diagnostic testing. We should also have preference to these we use. We don't use specific things like those that target maybe the parasite F, this English protein 2 kits, for instance. You now let that person have your facility or your blood bank, and you do the screen and you think you have done screening. What if the person is having misinfection? That kit cannot be able to detect the other malaria parasite. Because we presume that we have only infection for Plasmodium falciparum, but we will have misinfection. And that is why we should use a more robust RIVCHPP, like those that detect Plasmodium lactate dehydrogenase enzyme. And we have kits that are that material that know that WHO advocates is pan-malaria kit to detect many of the malaria species. We saw the species that infect man, about 5 of them. So that one can detect, even if you have misinfection, you can do that. So, I don't know.
If you use that, you will go because they are loaded, and so we will not just attempt to answer some questions. If you have questions, you just okay.
Sorry, I just want to add for medical laboratory scientists who are here and are practicing. One of the key indicators for malaria infection is thrombocytopenia. We don't think about it, we don't practice it, we don't do it, but it's one of the key indicators. Outside anemia is very powerful indicator of malaria infection. So let's begin to look at, there are other things too that we can do to add to hemoglobin estimation that we do to really help the life of patients. But thrombocytopenia is one of the key indicators to let you know that there is malaria in this person. Thank you.
Thank you so much. So let's have our questions, please. Okay, we have 1 here, 2, 3, 4, and I come here 5, 6, 7. So we have 7. Number 1, please just all of you who have questions, please come on so that we make it very snappy. Number 1, please.
We carry over questions and media.
Number 1, please.
Number 1,
Alright, so my question goes to Mr. Bruce, first of all, when you emphasize on using AI and the fact that you have to have in-depth knowledge on it. So my question is, what kind of AI, because we learn of skill as medical students, I'm a medical student and I'm a graduate of human anatomy. So what kind of AI skill can I actually endorse in? AI skill can actually help me with malaria, like specific area cost maybe, and one can really indulge into actually get that fixed. That's the first question. So the next is for Peter. So for him, talking about researchers, so how do we get involved in seeking researchers? You know, as undergraduates, you talk about collaborating. Are we supposed to collaborate with undergraduates like us? So how do you really get involved into the research community where you can actually have the opportunity to research? Thank you.
Alright, next. Carry over.
Alright, thank you very much. I think it was an interesting discussion. My question borders on endemicity and the rate at which we churn out malaria results in a positive direction. I've heard one of the clinicians said because malaria is endemic, so each time you present to the laboratory, it's expected that the result will be positive. And this has led to the fact that even the ordinary market woman will tell you, because it's endemic, I have no need to go to the laboratory. I already know I have it. And then it goes about buying drugs. How does this endemicity justify that anytime you have fever and you present to the lab, it must come out positively? Thank you very much. I think Professor Emaya was mentioning about the issue of endemicity and it was ACA, so I think we'll do this. Thank you very much.
Okay, my question is for the asymptomatic carriers of malaria, for Professor Edwin. These asymptomatic carriers, they don't know that they have the malaria, but it's true that this malaria still affects them, although mild, but in a little way affects them and it can affect their red blood cells. So, what are the remedies that you can use to help these asymptomatic carriers? Because it also affects the community and exact strain on their immune system.
Okay, my name is welcome Samuel, a quick one. To Mr. Bruce Lucas. Please, as an IT expert, there is a program for our youth who would want to engage in any form of medical research relating to your IT platform. So if you do, you should please let us know so that those who are interested can key to that. Okay, second question to Professor Peter Ayodeji. I want to ask, now what makes up a research group? What makes a research in case someone wants to venture into research? So what are required so that the audience can truly benefit from that? The third question to Professor Eze, please, we talk about blood transfusion and maybe those who have malaria, to prevent them from donating. This has been a very serious problem in our society. That's like what you say, that we say we will not allow those who have malaria to donate blood, means to have something of blood. That's what we say. But looking at it, are we doing the right thing? Because if you say, look at it the way it is, I think we're not doing enough. Because we keep recycling malaria peroxide from children, adults, and others. Thank you very much for
we have an unspoken law or habit that in Nigeria specifically, that once in every 3 months, you just can't take malaria tablets. Just automatic. Once it's 3 months, you just drink malaria tablets, whether you have it or not. So, and how can we solve that? And also, for the treatment of malaria, I heard certain people say that the injections, intramuscular and all that is much more better than the tablets. So, Professor Islam, I would like you to throw more light on that.
Good afternoon, everybody. My name is Bo, and political science student. And I would like to ask Mr. Bruce, political science is mostly about prevention. I'd like to hear your thoughts because I'm quite curious on how knowledge of AI and computer science can be impacted or how it can be leveraged in the preventive role of political science. And if it can, what are the skills and how can one acquire those skills?
I'm Constance Daly, and my question is directed to Mr. Lucas. I'm aware regarding implementing a drone technology in eliminating malaria. My question is, can Nigeria also go down part of eliminating malaria through drone technology, where data science are introduced to areas of malaria hotspots?
Okay, I also have another question. You know, the pastor of seven for the prayer. For me, I've been a victim of malaria, and I'm still a victim of that. And some years ago, I had an issue with bloated left feet that they said it's as a result of malaria caused by whatever it is. So I suffered it for so many years before I met a doctor who told me that I will be ivermectin and albendazole for 6 years, and I will be taking malaria tablet every time I'm taking those drugs. And those drugs I will take them like twice, once in a month, every month, meaning I'm taking malaria. My question is, don't you think that doing that will make me develop resistance to that particular drug? And what is the way forward? Because I'm taking it. Thank you.
I think I have the last question. Because I also have a question, and I think this is the right way to ask.
I've heard so many times that malaria can kill, but I've not seen anybody that died of malaria. So the nice to know how does malaria kill someone? Because we have a lot of things to take. We also take of malaria. We have a lot of things to take. So how often we still hear in statistics that people die of malaria? I think I'll direct the question to how does it kill someone?
Okay, so I think you should start with yours. The questions here, so I'll leave it to you.
Okay, starting with my questions. AI skill is needed for medical. That's the summary to the question. The person asked the first question, are you still here? Okay, so the thing you should know about AI, I think AI is overrated. There are too many noise about AI, and maybe I should just take a minute to explain what AI is. Can I do that? Right? Can I do that? So, listening from a computing perspective, AI is a new baby that is born and is taught certain things. You teach baby how to cook, you teach baby how to walk, you teach baby how to dance, you teach the baby music, you teach the baby what is hot and cold, you teach the baby this is A, this is B, this is C. You teach the baby several things. Teach the baby how to read, how to sing. And then you ask the baby, can you sing for me? And the baby sings and you're happy AI is singing. Is that supposed to be miraculous? No, it's not. It's the same thing that happens in the AI everybody uses. A server or a computer system was taught how to draw, was taught how to sing. They scanned several books and taught it how to write. They put several documents and taught it how to predict the next word. They taught it how to paint a picture. They taught it how to do several things. And then you would go to that ChatGPT and say, draw a human for me. And then when he draws it, you're like, wow, AI is awesome. AI is just a group of data that has been organized so much that you can ask me to use that data to produce a certain result. It's all data, right? So if you go to the same AI you know and feed it with information about you, that AI will recommend to you what thing to do, what thing to cook, what thing to eat at the same time. That's what AI is. So when they use AI in business or trading, like people that trade stocks or people that trade currency, they use AI because the AI has been fed with a lot of data about different companies and how their stocks have been going up and down. Then that AI will use that data to recommend which stock to trade and which stock not to trade. That's how AI works. So the intelligence of searching through millions of data and producing a recommendation that will likely work is where we call it artificial intelligence. But there are humans that have that same level of intelligence. Naturally, does that make sense? So the same way a human is so smart that he can do this business for you and make profit, is the same way that computer has a lot of data that it can use to produce that result. Bringing it to your question now, AI is just a computer system. So if you pick up any AI tool and you train the model on the results you want to achieve, it will produce that result for you, depending on the amount of data you feed that system. As just after you ask the question, I quickly did a search. Meanwhile, Google is your friend. Most people don't like using Google. I don't know why. Right? I'm about to sound very intelligent now because I Googled it. So I just checked it out. Digital pathology and imaging tools. You have Path AI, you have Page AI, you have TechSite, you have AI Doc, you have Elastic and Cellulose AI. And these are tools you can use especially for medical research. And there are others here for clinical data analysis and more. So if you know how to use these tools and train them with the data you have, you will definitely have that AI skill or AI advantage in your field. Then the next question is program for youth in med research. Uncle, no, just like what I said earlier, no, I'm not going to give you some fancy political answer. If there is a program for youth I am organizing, it's for tech. It's not for medical because I know nothing about medical. However, you interested in organizing a program for youth in medical research, you can contact me to be a facilitator in your training. You can contact us to be a facilitator in your training. And then you can contact the youth to come and learn how to apply tech in medical research or how to organize in medical research or whatever. So you can organize it. But me and program, no. Thank you very much.
Thank you very much.
Knowledge. I have two last questions. Knowledge for preventive health and skills on how to do it. I don't know. I don't know really. I don't have knowledge for preventive health because I'm not in the health space. If you ask me about tech, I'll tell you freely, right? But I don't have knowledge for preventive health. But if you want more answers, you can use the AI we tech people have built. And then you can get some answers to the questions you want, right? And then some students are really afraid to approach lecturers. I think that's something I missed in school too. Approaching your lecturers can just give you further insight to certain clarity that you need. So don't be afraid to approach your lecturers because they've done a lot of work and so deceived. So this question can go to one of the lecturers. Thank you. Then the last, eliminating using drone. Yes, that is very possible, right? So we have drones that fly over and do like geographic analysis or geospatial analysis of a certain area. And there are sensors that can tell heat in a certain area and water clusters in a certain area and so on. So yes, it's possible to have drone technologies that can be used towards the eradication of malaria, but that study has to also be taken into a research level where it gradually produces enough information to say it can work in the Nigerian context. And that will be the answer to my question. Thank you.
Thank you.
Thank you very much, Mike. Those questions. Someone asked about collaborating with citizen researchers, right? As an undergraduate student. Oh my God. Anyway, I'll give you an answer. You will not be disappointed. The first thing as an undergraduate student, you understand that we are still under mentorship. Right? We are still under what? Mentorship. So you must understand that you begin to associate with your professors. Especially if you have an interest, that's you begin by studying their work, what they've done in the past, what they have studied. You can go to Google Scholar, right? With Google Scholar, you can find out some of their researches, and you can know who and who is doing a particular research in that area you are interested in. By so doing, you can easily walk up to that professor, sir, I'm reading some of the works on social area, I'm also interested in that area. That is where you start from. So once you are being mentored, it's easier for you to now begin to say, Prof, I have this idea. You understand? I have this proposal. You are not the one to write the proposal. You can suggest to the professor, I have this idea, I have this proposal. I don't know if you can fly. If you, as an undergraduate student, it's very difficult for you to write a season proposal. I'm telling you the truth. Because the techniques and all the rest are not out now. But once you allow the professors to mentor you, they can give you an assignment, you carry it out, and before you know, like try you are coming back from your master's and then you do proposal writing. That's where to start from, okay? Then the last, there's also what we call exchange programs too. Exchange programs are also very good, whereby you can, as an undergraduate student, you can travel out to the country to do maybe a 2 weeks or 3 weeks program that is usually not common. But once you get an opportunity, you can help to develop. Then the meeting like this you are attending, right? You attend meetings that talk about proposal writing and all the rest and develop the skills and the work. Then for my brother, Black, I know my brother, my younger brother, from Black. back, talk about the research group. Primarily, the research group consists of the principal investigator. He is the main man, and he's usually a professor. For example, for technical projects, right? For technical grants, you ask for the principal investigator. Then you have other classes of lecturer, from lecturer 2, lecturer 1, and lecturer that have been part of research. And they will form the entire research group. Is that okay? Thank you very much.
Thank you. So we pass the news. Okay.
Thank you. First, let me start with I'm not saying people die from malaria. And I pray you don't see it. Now, malaria has two phases. We have subclinical and asymptomatic. You can carry malaria like this because your immune system is fighting for it. Not everything that comes into the body brings us down. God has put some systems in our body to fight them. So that you are not down, does not mean you don't have it, but your body is fighting it. Then you have clinical malaria. When you have clinical malaria, it's showing symptoms. You have fever, you have everything, and it's systematic. It affects all the systems in the body. And when they affect all the systems in the body, both your liver, your brain, you see people behaving like the mad people when they have malaria because their brain barrier has been broken. They have passed through the brain barrier and then they begin to behave. So it affects every aspect of it. It can even raise blood pressure. You know, it's a systemic disease which nobody prays you have that kind of malaria. So malaria really is deadly when it gets to that point. And if you get to the hospital, you see many of them who are, you know, having your hemoglobin will get so low, maybe to 4.5 point, and you're looking for blood everywhere to save a life. So malaria kills, and it's still killing till tomorrow. But factors which aids in the malaria disease severity are species. Like we know that in this area we have one species that is very deadly, which is plasmodium falciparum. The species matters. What species of the malaria you have matters. You also have the parasite density, the quantity of the malaria that is inside your body matters. You know, if there is a level, the quantity of malaria will get into your body, even the drug. It cannot even kill. And then, you know, so the quality matters. So, and then you also talk about the host factor, the person, the very person who is carrying the malaria. Is he a child of a baby under 5, the pregnant women who are most susceptible to it? So those are the factors that help in disease severity. But you are a very young man, your blood is very intact, so you will not experience this. So I pray you don't experience them. So then somebody asked for endemicity. I did not say anytime you go to when there is because of endemicity, malaria results in the hospital. I didn't say so. I only say that if you take our blood here, 80 to 60%, 60 to 80% of people here will have one malaria parasite or the other. And I also mentioned that if you really want to get malaria diagnosis, very fine. At the point you have your temperature at peak, get to the hospital or get to the laboratory and collect your blood that time. The possibility of seeing it is very high. That's what I said. So that we have malaria here does not mean that everybody will go to the lab and have malaria. That is for those of us medical and public scientists who feel that because malaria is always here, so everybody should have. No. You must be skilled. If you don't have the skill to examine malaria parasite slide, don't give a result that the person does not have. It's criminal. So please, I know that sometimes too, the clinics also help aid in this thing. If they want to see positive results, but they can treat patients. So these are fraudulent practices that kills people. Let's not engage in it. Somebody asked a question that they has a problem taking malaria monthly and won't it cause resistance. Well, the problem is being managed by a physician, and he knows why he has to take it. But for you to know whether there is resistance or not, you need to go and be doing malaria test. If the malaria clears, then it means the drug is working. But if after taking the drug and then the malaria did not clear after the second test, after you finish taking the drug and you go back to the lab and do the test, the malaria is still there, that means there is resistance. So the only thing you can do to help yourself is to go back to the lab and repeat the test again. After taking drug, you are supposed to go back and repeat the test to be sure that the drug has cleared the malaria. If it doesn't clear it, then there is resistance. And then you can now report to the physicians who are treating you. So, somebody asked, as asymptomatic carriers, what do you do to help them? Virtually there is nothing. You are just, as you stand there or sit there, you may have it, but you don't know. So the body takes care of it. You don't need to go and take drug. Maybe think that, oh, it's possible that you have malaria. Let me be taking it every month to prevent it. You don't need it. If you don't have any symptom of malaria and you are not diagnosed to be having malaria, there is no need taking any drug. Your body takes care of so many things. Your immune system takes care of so many things you don't know. So as you are sitting down here, even me, I may have, but my body is taking care of it. I don't need to go and buy malaria drug. Oh, maybe Job said, what I do fear come is what come upon me. People who fear to be sick, you become sick. And those who are afraid, it's possible that they be sick. Before you know it, the sickness will come. But God has put wired your body in such a way that you don't need to create that fear. But when there is need, do the needful, and you will get the answer. Thank you.
One of the questions said that please we screen. What is then the ready man? Since we screened the donors before the meeting, was there a relevance of asymptomatic carriers? Is it not possible to detect that they are not fit to donate? And I said that the answer is that it's not possible in some cases, because we have a certain cutoff, particularly for hemoglobin level. Remember we talked about malaria affecting the hemoglobin level, causing anemia. If somebody's hemoglobin level is supposed to be 15 and it's 13 because it's having low grade, is asymptomatic. When the person goes for hemoglobin testing, the person will pass the test. So that does not exclude the fact that the person does not have that, but has passed that hemoglobin test. Particularly if it is low grade, if the parasite density, the number of parasites in that person is low. But when you now transfuse that thing we call low parasites, number of parasites, to somebody, particularly the vulnerable group, it can cascade to something that can even kill that person. So, and that also answer the question of shortages of blood. Somebody said, is it because of shortages of blood that will not screen everybody? The answer is that for us in this line, we can't screen everybody. It's not feasible because of the low income. We don't have the financial capability to do that. So what do we do to help ourselves? Those that are not, of course, basically most of us are immune to an extent. So the those that are immune, they are not having other challenges. If they get transfused with infected and giving, like remember I talked about presumptive prophylaxis, that giving malaria parasites with the intent that this blood may harbor some parasites. Those blood should be able to help them, and then they will now harness the benefit of that blood transfusion. Because some people actually need blood transfusion. Of course, you give blood when it is absolutely necessary, and when it is absolutely necessary to give blood, it means you have to continue to save that person's life. So if you now begin to rule out all of maybe 55% of the population from giving, and knowing the fact that in this part of the country that we don't even have enough voluntary unpaid donors, because there are the ones that don't have there are the ones that are the best donors. WHO advocates for that, but they still use commercial donors, and these commercial donors they still carry this parasite. So it's still needful that we target screening to help our population. Then the other one, somebody asked, why is it that injecting transfusion has more serious effect than when the mosquito bites the person? I use painkiller as an analogy. If you are having severe pain, and then you go to the doctor and you're giving paracetamol injection, and then the other one is having similar severe pain, is giving paracetamol tablet, or even in another time you're giving paracetamol tablet, you see that the injection acts faster than the tablet because it goes straight. It does not have any interference along the way. But the one that you swallow, it has to be metabolized. The active ingredient in that drug has to be absorbed before it can act. It takes longer time. The effect of the action is equally decreased. Unlike the other one that goes straight and acts immediately to relieve the patient. I think that.
Thank you so much. Please give a round of applause for our panelists. They did so well. We can still engage here outside of this place. So we want to say thank you, and thank you, and thank you. This action, not all the time words and listening. Let's go back. Let this be something that will challenge us to do something new and ensure that we are part of the ambassadors to eliminating malaria. Thank you so very much.
You can do better than that and clap for the panelists who've done so well. Please, we want to invite professors, deans of faculties, heads of departments, directors, to come to the podium to photograph with our panelists. Please, if you're here. Please, the representative of the bank should please make your way to the podium because you will take a brief goodwill message. I think you should also come up to the podium to take a good photograph with our panelists. It's very important. We are almost come to the close of the event. Really after the goodwill message from the representative of the PAMSEC and the secretary, Dr. will speak, President of the EKPRIKPO Health Foundation, will be taking his remarks. Please can you join us on our hands together for our panelists? They have done wonderfully. The PAMSEC representing the representative of the PAMSEC Ministry of Health, please can you just make your way to the podium to take. Sorry, I was not giving your name, so I didn't. Please can you join us wonderful hands together for wonderful work. Thank you.
Good afternoon, everyone. First, I want to say thank you to the Permanent Secretary, Professor Justina Jumbo, for this opportunity to present her in this auspicious event, EKPRIKPO Health Foundation Colloquium. Standing on already existing protocol, this is from the Professor Justina Jumbo, the Permanent Secretary, Ministry of Health, Rivers State, at the 5th Annual Malaria Health Colloquium, Rivers State University. It gives me great pleasure to be here today on behalf of the Rivers State Ministry of Health at the 5th Annual Malaria Health Colloquium. I wish to begin by expressing sincere appreciation to the organizers, particularly the EKPRIKPO Health Foundation, for their consistent commitment to advancing conversations and practical solutions toward malaria control and elimination in our society. Malaria remains one of the most persistent public health challenges in Nigeria and across sub-Saharan Africa. Despite significant progress made over the years, through coordinated interventions, malaria continues to place a heavy burden on our health system, our communities, and our community. It affects productivity, strains household incomes, and continues to threaten the well-being of vulnerable populations, particularly children under 5 and pregnant women. In Rivers State, the government, under the leadership of His Excellency, remains committed to strengthening malaria prevention, diagnosis and treatment as part of broader efforts to improve public health outcomes. The Ministry of Health continues to collaborate with national programs, international partners, academic institutions, and civil society organizations to implement strategic interventions that reduce malaria transmission and its devastating impact. It is therefore very encouraging that this year's colloquium focuses on the theme, accelerating malaria elimination through academic innovations. Rivers State University leads the way. This theme is both timely and strategic. The role of academic institutions in advancing public health cannot be overstated. Universities serve as centers of research, innovation, and intellectual discourse, where evidence-based solutions are developed to address the real-world health challenges. The collaboration between academia, government, and the broader health sector is essential if we are to make meaningful progress in malaria elimination. Research findings must not remain within academic journals alone. They must translate into policies, programs, and community-level interventions that improve lives. Events such as this colloquium provide a vital platform for 1. Sharing emerging research and scientific findings. 2. Promoting dialogue among policymakers, researchers, and practitioners. 3. Identifying innovative strategies for malaria control. And lastly, strengthening partnerships that support sustainable health interventions. I commend the organizers for creating such a platform that brings together experts, scholars, health professionals, and development partners who share a common vision of a malaria-free society. The Rivers State Ministry of Health recognizes that the fight against malaria requires a multi-sectoral approach. No single institution can tackle this challenge alone. Government agencies, research institutions, healthcare providers, community organizations, and the private sector must work collaboratively to develop and implement sustainable solutions. In this regard, I wish to assure this gathering that the Rivers State government remains open to partnership that strengthen malaria prevention and control programs. We welcome research-driven recommendations that can inform policy formulation and guide the implementation of effective interventions across the state. Furthermore, community engagement remains central to malaria elimination efforts. Beyond policy and research, success ultimately depends on awareness, behavioral change, and access to preventive tools, such as insecticide-treated nets, environmental sanitation, prompt testing, and effective treatment. As we deliberate during the colloquium, I encourage participants to encourage meaningful discussions, share innovative ideas, and explore practical pathways that can accelerate malaria elimination, not only in Rivers State, but across Nigeria. Let me once again commend the EKPRIKPO Health Foundation, Rivers State University, and all partners involved in organizing the important event. Your dedication to advancing public health knowledge and action is truly commendable. It is my sincere hope that the outcomes of this colloquium will generate actionable insights and strengthen ongoing efforts to combat malaria in our communities. With these few remarks, it is my honor and privilege to formally welcome you all to the 5th Annual Malaria Health Colloquium and wish you very productive deliberations. Thank you and God bless you.
We can do better than that. Thank you so much representing the permanent secretary. This at this junction we are almost at the end. It's not the end of the event. Please, somebody should call the convener of the event. Please, some things are going on for refreshment. Be careful about what you take so that you don't have malaria, because we're talking about malaria. No matter when I chop rice, I get malaria. When I chop them, I get malaria. I remember the question that other young man was asking. Anywhere you go, they will tell you the average African or the average Nigerian, if you check his blood sample, you must have malaria. You must have malaria. And that has always hindered people from going to the lab to be tested what is happening. So that your question is quite hard. Distinguished ladies and gentlemen, to wrap up this event, I want us to, with a clap ovation, welcome Dr. EKPRIKPO ERENS. Thank you.
Thank you very much. So the first will be the last. So what are we? The last or the first? I sincerely want to thank everybody for this event. We are because you are. If you did not come, all the organization, all the tireless, sleepless nights will be wasted. So I'd like everybody here to give a round of applause to yourselves. We've actually made history today. I think since the inception of the Colloquium, this is our biggest crowd. Over 1,500 participants. You can see that not just that the event was packed, it was completely free. So let's celebrate all our partners for this. As we say thanks to the Digital Vice Chancellor and our erudite Professor Seb Obi, Isaac Seb Obi. Let's celebrate the Vice Chancellor. You can see everything here. This place is not easy to use, but the Vice Chancellor believed in this program and gave us. So let's celebrate the Vice Chancellor once again. I sincerely want to appreciate the leadership of RIVCHPP. You see her, Dr. Betty Agala. She was also a support. And we have this wonderful celebration, and of course this engaging moment together. So on behalf of the board, the members and volunteers of the ERENS and EKPRIKPO Health Foundation, I'd like to congratulate all of you for being part of history, the 5th Malaria Annual Health Colloquium. Celebrate yourself. So our distinguished panelists, keynote speakers, moderators, I want to ask, were you not engaged? You were? Were you not entertained? You were? And didn't you go with something? Thank you. Of course, certificates are already on ground, so all participants are already from here. Just go to the registration desk. The certificates are already printed. So celebrate the planning committee again. I'd like to thank my brother, friend, and the beautiful thing about it Professor Ekumu. Thank you very much, sir. And so, my very good friend Lucas Bruce is being a very big supporter of what we do. The CEO of Colloquium Square. Your hands together for him now. And I want him to come on to do one little survey. This might be another avenue for you to engage and see EHF will be part of what we will do very soon. Please let's welcome Bruce Lucas. So we'll have a survey here that will lead us to another level of this, from what we located or what we identified from this colloquium.
Hello everyone, once more. So it's a simple poll, right? It's a simple poll, and it's just to ask in the room, by show of hands, how many of you would be interested in learning how to use AI for medical research or medical lab, your practice? By show of hands. Okay. That sounds awesome. So I'll have a quick conversation with the foundation to organize a short, maybe 1 day, I don't know if 1 day is enough, 1 day, 2 days or 3 days training on how to use AI in your practice, how to use AI for research, and so on. We're going to identify the tools just like the ones I mentioned to you. And then we're going to contact the companies that build those AI tools and see if they can give you a 1 day webinar, 1 day training on how to use their tools or how to use AI in conducting your research or in training the AI to achieve the kind of results you want to see. And that training should be free. We'll make sure it's free. We'll make sure it's free. So that's it for us. Thank you very much.
Thank you, Mr. Lucas Bruce. So from one to another, right? So on that platform that we have, Don't Exist Yourself, we'll see you utilize that platform for that. I'd like to thank Solve TV. Thank you so much, sir. I'd like to thank Inside the Niger Delta and also especially our volunteers and members. I want to also celebrate my mother. She's the one that gave birth to me, so there is no without her. Thank you very much, man. God bless you. At this point, the way I close, I'm just a human being that is being used by God. There's nothing here. I'm just one very normal person. No special thing, just God. So please let's rise. You help me sing this song. Then we'll close. All the glory must be to the Lord, for He is worthy of our praise. No man should give glory to Himself. All glory must be to Thank you very much. At this point, I would like to call some. Alright, let me get to give my brother Maxwell to give us a closing prayer. Let's welcome Maxwell as he takes a closing prayer. After here, please everyone that was registered, go to the stand there and take your certificates. Stay on the WhatsApp group, we will continue engagement there. Thank you. Then after here also, the red carpet is for, or green carpet is for your pictures. Make sure you make it go viral. And of course, celebrate yourself for what you've been part of history. Thank you.
Let us pray. Our Father and our King, the Father of our Lord Jesus Christ and our Father, we thank you for a day like this. We thank you for your mercy that has prevailed. We thank you for the organizers of this event. Pray, oh Lord, the blessings you bless them. Lord, you will increase them with wisdom, knowledge, and understanding. Thank you, oh Lord, even as we dismiss. We are not dismissing from your presence. We pray, oh God, that you grant our journey blessings back to our different destination. Let your name alone be glorified. Let your name alone be worshipped. For we pray in Jesus' name.